All right. Good evening, everyone, and welcome to ATP Live Monday. I'm Demisela Boyde. It's a pleasure to be here today to talk about the health of our children. So, welcome, whichever platform you're joining us from. And what I'm going to do is to first share the video so that everyone can see us. Okay, I'm just waiting for my video to be live here. So good evening everyone. Alright, I think it just puts me in an event again. Right, which is not what I always like, but I guess I just have to manage it. Alright, so welcome everyone. I'm just going to share the video. Okay. I'll do it on my phone. It's really making a lot of noise. Okay. Good evening, Instagram people. I hope you can see. Okay, yeah. All right. So let's just share the video first. So welcome everyone. I'm just sharing the videos to our groups. Welcome, whichever platform you're watching from. You're welcome. And I'm just trying to share the videos to our groups. Just give me a couple of minutes to do that. Okay, so welcome, whichever platform you're watching on. And also invite these records to share the video so that other people can see and they can hear. Okay, so I think I'm done with all the sharing. Just a little bit more. Okay. Okay, then I think now it's just to pin the posts in the groups. Okay. Okay. All right. So I've done the pinning. I think I'm not quite sure which other groups. Okay. Okay. So I've done all the sharing, all the pinning. Good evening, everyone, and welcome to ATP Live Monday. I am Bimisela Boyde. I'm a pediatrician, and it's my pleasure to be here today. ATP Live Monday is brought to you by Ask the Pediatricians Foundation. We are committed to the health and to the welfare of all children globally, but more especially in sub-Saharan Africa and Nigeria, where our children are still dying from preventable causes. So that is what we do. We empower parents with health information, health education, so that our children do not die of live. So we do that through our online platforms and also through our uh, community medical outreaches. And we've been doing a lot of outreaches in recent time in celebration of the Children's Day. So thank you so much. So ATP Life Monday is an opportunity for you to ask any questions that you may have about the health of your children, and I'll try and answer them over the next 60 minutes. So whichever platform you're watching from, on Instagram, you're welcome. On Facebook, on YouTube, any of the platforms, you're welcome. Remember to, if you're watching in the groups like Super Parents Foundation group or Ask the Pediatrician group, you need to click on the video, and that will take you straight to um, the video itself, so that you can drop your comments under the video directly. If you drop your comment just in the link in the group, I will not be able to see it, and I may not be able to answer your question. But if you drop your questions directly under the video, I'll be able to see. But if you're watching on Facebook page, YouTube, or Instagram, that doesn't apply to you. You can just drop your questions straight under this video, and I'll be able to answer them. And when you're asking your questions, try and start with the age of the child. It's very important for us as pediatricians to know the age of the child, and also try and put a summary, of course, because most time Facebook will cut off some of your messages if it's too long, so we'll not be able to see everything. So try and keep it short and simple. Tell us what your concerns are and what exactly you want us to address in the question. So thank you so much for joining me today. So feel free to, the door is open now. You can ask any questions that you may have about the health of your children, and we'll try and answer them. Sometimes I also do a little bit of teaching around some of the issues that parents do ask about. So if I don't get enough questions on time, I can do a little bit of talk or teaching on some of those common issues that we to face as parents. So I'm very grateful for you for joining me today. I hope you've had a lovely Monday. Monday is always like a crazy day for most of us. So, but if you're able to join us, that's fine. If you still have questions after the live session is over, remember that you can go to our Facebook group, Ask the Pediatricians Facebook group online, and you can post your questions there. We will be there for you 24 hours every day of the week except Sunday. So feel free to post your questions on our Facebook group, and we'll try and answer them. Of course, for children who are very sick, we recommend that you take the child to the hospital and not just leave the post on the Facebook group, because we are not always there, so we don't have capacity to deal with emergencies. So for urgent and emergency situation, we strongly recommend that you take those children to the hospital for us to see and deal with quickly. So, but for just ordinary health information and all that, we are happy to do that online, and we are happy if you leave your questions there for us. Please remember, we also have a website, www.askthepediatricians.com, where you can read about this topic. You can also follow our podcast channel to listen and watch. You can also watch all the past videos on our YouTube channel. We are always there. We don't delete the videos, so all the past videos, all the teachings, they are on our YouTube channel, and you can always watch them and learn more. You can search for the particular topic you are interested in, and when you search, you can always learn more about that. So I think those are my summary, or what do you call it now, intro. But I'm right here now, and I'm happy to take any questions that you may have about the health of your children. I can't seem to see any questions yet on Instagram or on Facebook. So I'll be waiting. But while waiting, we want to talk a little bit more about the importance of immunization. So let's remember to take our children for their immunizations. We all should have our immunization card. And people used to think that immunization ends at 1 year. Some people think at 2 years. Actually, immunization does not end at those ages. So we now have the human papillomavirus vaccine, HPV, which is given as between 7 and 9 years old. I think for Nigeria with 9 years old. So please remember that. I don't think that once you've taken your 9 months, most mothers, once they take the 9 months vaccine, they tend to forget everything. No, there are still more vaccines beyond the 9 months vaccine. We now have the booster measles 2, which is given at 12 months, and we also have the HPV vaccine, which protects our girls especially against the HPV infection, which is strongly associated with cervical cancer. So we strongly recommend that you don't forget to take your children for these immunizations. They are always available at the health centers. So just walk in and talk to them, and you should be able to give it to the children. Also, if you've mixed vaccines before, maybe you were supposed to have taken your children for specific vaccines, you forgot, you traveled, all those kind of scenarios, you can always go back and take the vaccines. So it's not like there are certain vaccines that there is a little bit of deadline on them. Like if you miss those ones, for example, rotavirus vaccine, we want it to be given to children before the age of 1 year. After 1 year is really not a major issue, so you're not likely going to get that given to your child if you go after 1 year. But most of the other vaccines, like your BCG, your hepatitis B vaccine, they are still relevant even for us as adults. So any child that needs those vaccines, we are going to give it to them. So please, if you have, please, as I'm talking now, if you have access to your children's immunization card, please go through them. And if there's anything missing, please go to the health centers and they can give the children, because these vaccines protect our children against these horrible, horrible diseases. Even in places like UK now, we're beginning to see outbreaks of things like measles and all that. These were things that they were not dealing with for a long time, but because there have been some drop in people uptake of vaccine, and people don't take it as seriously as before. So even in countries that tend to think it is not a big deal to them, they are now beginning to have them. So it is important that we ensure that all our children are fully immunized for their ages. There's no point for them to go through those illnesses when we have vaccines that we can give them, and it will protect them. So that's just a little bit of a reminder about vaccines. So if you welcome, for those who are just joining us, you're welcome to ATP Live Monday. This is a program where you can ask questions that you may have about the health of your children, and we try and answer them in the next 60 minutes. Now, maybe 45 minutes left that I have. But that does not mean that if you have any questions after the live section, feel free to post your questions also to our Facebook groups from Mondays to Saturdays, and we will try and answer them as soon as we can. But if children who are very sick, please take them to the hospital. All right, so I hope that is helpful. Um, I do talk a lot about things that are emergencies, so that if children have certain conditions, we should actually rush to the hospital. So I'm going to retreat them, and it will start with what we call airway. Any condition in children that affect their airway, so that if the nose is blocked, they can't breathe through their nostrils. That is an emergency. If a child cannot breathe, that is an emergency. So for those kind of condition, we want you to bring the children to the hospital. Please do not pour water on children if they faint or if they stop breathing. No, water is not a form of resuscitation. I know we see all this a lot in our Nollywood movies, and I really hope Nollywood producers and should listen to us. And these days, you can even hack AI, all these things. So we should not be demonstrating those kind of scenario in our movies where people collapse or they faint, and the next thing is people pouring water on them. That is not the right thing to do. So if somebody fainted or somebody is having acute cardiac arrest or anything of those nature, it is meant for them. The most important thing is for us to get their heart beating and for air to go through their nostrils. It's not by pouring water on them, and it's not by crowding them up and all that. So, but those are emergencies, A and B, airway and breathing. Anything affecting those two, you have to bring the children to the hospital. It's an emergency. Okay, I got my first question, so I will answer that and then continue my gist about what are the acute things, emergencies, things that should happen to our children, and we should bring them to the hospital. So, Falashade, thank you so much for joining me, and you're my first question today. Good day to you, ma'am. My 7-month-old baby is having rashes that come and go. Okay, rashes that will come 5 days out of 7 days a week. Okay. I got baby Tributan, but it's not working. No change of soap, cream, but she just started semi-solid cereals. All right, that's a very good question for Lashade. So if your child is having rashes that are on and off, so it's most likely the child may be reacting to something. So if the rashes come on and go, it could be that there's something new you've offered the child, and the child may react to it by having skin rashes. And it takes a while for you to know what it is, but the most important thing is to pay attention to what is new. From what you're telling me now, you just started this child on new foods and cereals, so you need to pay attention. Does the rashes do they come up when the child has eaten a particular food? Again, this is why we don't recommend giving your children mixed cereals. Some of us tend to give our children some of these cereals that they've mixed with so many other things. I don't want to mention the names of any of them, but you know what I'm talking about. And they're quite common. They all go by different names, but basically it's a mix of so many things together. And a lot of mothers love it. They always want to go and give their children that, but we don't recommend that. When you are starting children on new food, don't give them mixed products, mixed cereals. It's better to do one new food at a time, so you know exactly what the child is reacting to. But if you are given a mix of so many things, you put the fish, you put the egg, you put the crayfish, you put the soya, you put maize, you put millet, you put sorghum, how are we going to know which of them the child is reacting to? So my advice usually for parents that when you're starting new food, you start with one. So if you want to do pap, let it be plain pap. Of course, you can add a little bit of sugar, you can add your breast milk, your child is already taking breast milk before, so the child is not likely going to react to that. So you can give that, and if the child is able to tolerate it, at least then you know that at least for the meal, for the uh, maybe let's say mixed based cereal pap or whatever that you've made, the child is not allergic to it. So if another time you want to add something else, you can add maybe your grounded crayfish or your ground granules or soya, whatever. So if the child reacts when you had something extra, then you know that it's a new thing you've added. But if you give the child something that is having a mixture of so many things, you're never going to know which one the child is reacting to. So which is why we don't like all those your bomb, you know what I mean? All those your cereals product that ends with bomb, because most of them are mixed cereals. It's not as if there's anything wrong with giving them, but that's not the first thing to start with, because at the time when you are starting at 6 months, 7 months, you don't know what your child is allergic to. And allergies can be mild. So, for example, what you described could be mild reaction to something, so rashes and it goes away. But we can actually have what we call anaphylaxis, very severe allergic reaction that can kill. So, some children are very allergic to nuts. So, usually, we don't even want you to start children on nuts, when you're starting at 6 months. And the first time you're giving them, we want you to give very tiny piece and see whether they're able to tolerate it without having any swelling of their mouth or tongue or anything. Because some children are very strongly allergic to groundnuts, peanuts, some other things like that. So some children even react to eggs, some children react to fish. So there are many things that children can react to. So we always want to know what exactly the child is reacting to. And so you have to pay good attention. You may have to stop everything and then restart them one by one, and then notice which one do I give, and the rashes come out. Because the solution to allergic condition is just to stop what the child is allergic to. So there's no special treatment for allergic kind of reaction. So if you know what the child is reacting to, you stop it and the rashes will just go away by themselves. Doesn't need like cream or anything. So I'm not surprised that the cream you're using is not working, because that may not be the solution to it. So the most important thing is to know what exactly the child is reacting to, and then you stop it, and then that's it. So I think you can restart. It's not difficult to do. Just do one meal at a time and pay attention closely. Another. But if you do all the new stuff and you notice it's not the rashes are still coming up, it's not the food. There are many other things that children can react to, things that you don't even think about. Even like the soap, even the water. There's so many things. So sometimes you may need the help of your pediatrician to help you work it out. So you may want to come and see us in the hospital, because we can now, do a proper diary, look into things. Sometimes we even do allergy challenges and all that to know what exactly the child is reacting to. But the good news is, once you stop what is triggering the reaction, then the rashes will just go away by itself. So, Falashide, just go try them and try some of these strategies I've mentioned. If you're using any of those mixed cereals, you just have to stop it first and try and introduce one new thing at a time, and then we'll see how it goes. Okay. All right. I got a question on Instagram. So let me quickly take Instagram question before it will disappear. Show me for King, longest time. How are you? We've not seen you for a while, but it's good to have you here today. Please, can warm? Do you mean warm? Warm, WORM? Okay, I guess that's what you mean. Can warm make a 5-year-old to be grinding her teeth when sleeping? No. So a child who is grinding the teeth when sleeping, that is not warm. So that is what we call bruxism. It can be an habit. Some children just grind their teeth as an habit. There's actually nothing wrong with them. It's just an habit, but it can be a bad habit, because sometimes it wears off the teeth and the dentists don't like it. So, but if you see the dentist, they can give you something to put in the mouth of the child too, so that it will affect the teeth rubbing against each other and wearing down the enamel. That is the white part of the teeth that you can see. So that is one option. Sometimes some children grinding their teeth have what we call, they actually have what we call subtle seizures. They actually having a form of convulsion, if you know what I mean. And that's grinding is one of them. So sometimes we just need to be sure. But usually those children will have other signs, other problems, neurological issues. But so if it is not any of those ones are not there, then it's most likely just a nappy thing. So if you're worried about it, you can see the dentist. But most time it is not worms. It has nothing to do with worms at all. And you ask, is one medicine over the counter? Yes, one medicine, the warming tablet, the warming syrup, they are over the counter. You don't need a doctor prescription to buy any of the worms expellers. So just walk into any of the pharmacy shop. You can buy any worm expeller that you like. We have common ones like albendazole. There are different brand names, but that's the most common one. We also have things like combantrin, the parental palmates, that's also available. So they are all available. So the most important thing is to, when you buy, you just ask them the correct dose for your child for deworming. So they will tell you. Sometimes they may have written it on the pack as well, because it's something you can administer by yourself. For example, most of the albendazole for children 2 years and above, like this is a 5-year-old, is going to be 400 milligram. And the interesting is that the dose is the same for everybody. The dose is the same for children and adults for albendazole. Any child 2 years old and above to adults is the same dose, it's 400 milligram. And so if you buy the bottle, most of the bottle will come as 400 milligrams. So it may be 20 mils or 10 mils bottle, but it will be total bottle will be 400 milligram. So if you're giving it to a child like 2 years old and above, the child will just bring the entire bottle. 20 mils or 10 mils, drink everything, and that is it. The only group of children that the dose is different is the 1 year old. We don't do one before 1 year old. From 1 year old, they will take half, that is 200 milligram. And so if it is 20 mils, 400 milligram, that will be 10 mils. And it's just once, and that's it. And you can repeat it after 6 months. That is regular deworming. But for a child who already has worm infestation, their treatment is different. So the difference is that we treat them for like 3 days and then we repeat it after 2 weeks. But for children who don't have worms, they are not passing worms, and you just want to deworm them, like what we call prophylaxis, to prevent them getting worms. So that's the one I mentioned, that is just once off, 400 milligram, 2 years old and above, 200 milligram, 1 year to 2 years, and then it's just once, and then you can repeat it after 6 months. So it's not every 3 months. I know some others do every 3 months. It's actually every 6 months, but it's okay. At least you're not causing any harm, and it's over the counter. You can buy it. All right. Pretty Debbie, he said, "Good evening, Mark. Please, can a baby be affected when he or she cries too much?" What do you mean cries too much? Because sometimes we always need to quantify. So for me, it's not the crying too much per se that is affecting the baby. It is, why is the child crying too much? That is a question I, as a pediatrician, wants to know, because normally children should not just be crying and be upset all through the day. So there's what we call inconsolable cry. So if a child is crying and you as a mom, you carry them, you pet them, they should stop crying. That is a normal reaction. But if a child keeps crying and all the efforts to get them to stop or to console them is not working, they are what we call inconsolable cry, or they are crying too excessively with high pitch, cry and all that. That sounds unusual. We need to see that child, because we need to know why. Because that may be a sign of a child who has irritable brain. Something is making a child uncomfortable, something is making the child to be crying, and every effort by the mom to console them is not working. So sometimes we need to see those kind of children to be sure that there's nothing else going on. So that's why it's a little bit tricky to say, when people say cry too much, I really want you to quantify it. Like, is the child crying from like 8 a.m. in the morning to 8 p.m. at night? I know the child crying for 30 minutes may sound too much for a parent, but not necessarily too much. But I think the key word is the fact that if you're able to console the child or not. So we want you to be able to console that child. And if you're able to console the child, yeah, that's fine. I used to drop him off. Always start every question with the age of your child. You have not told me the age of this child. So you used to drop me off crash and they complain it cries too much. Yeah. So what is the age of this child? So there's also what we call separation anxiety. So when you drop off your child, obviously the child is separated from you as the mother. So the child is going to cry. That is a normal reaction. I'll be surprised if the child doesn't cry. I'll actually be more worried about that. So, but initially when children are new to a new environment, they will cry a lot. It takes them to time to settle in new places. So some children settle faster, while some children may take longer. Okay, so an 8 month old, yes, an 8 month old is going to have what we call separation anxiety. That is the age for separation anxiety. So this is the age where the child knows you as the mother. So the child is going to cry if you drop the child off with strangers. So they have what we call stranger anxiety, and they are not going to be happy. So, and of course, it's not going to be easy for them to console that child at that point. So, because the child wants the mother. So, that is not classified as crying too much because that child is going through changes. That child has been separated from his primary caregiver. You are the one the child knows for the last 8 months. So, you're just dropping him off with complete strangers. It's going to take the child time to get to know those people, to be comfortable around them, and to allow them to comfort him. So I don't know how long you've been doing that, but sometimes it can take weeks, it can take up to a month or even two or more. So but usually by that time we expect the children to settle. But some children actually can take much longer to settle. Some children actually are more difficult to settle. But if the child, when you come around, the child stop crying, the child is happy, that is not classified as crying too much. That is just a child having pure separation anxiety from the mother, which is completely normal at this age. So we will not be worried about that. But you have to also bear that in mind. So if your child is not yet settling at the crèche, you may want to reduce how much hours the child stay at the crèche. Actually, so when you want to start introducing children to crèche, you're not supposed to just drop them for the whole day and go away. No, that's actually not fair on the child. So usually if you are going to be going to work and your child is going to go to crèche, you need to start introducing them gradually. Maybe you could take them for one day. You can take leave from work, maybe 1 or 2 weeks, so that to get the child settled into the new environment. You can take the child for 1 hour, then you go. After 1 hour, you can come back, pick the child, or you stay around as well, So let the child gradually get used to it, then you increase it to 2 hours, 4 hours. That is how we work, even for school. And this is even not for an infant, even for school children. When they start nursery, you don't just throw them into 8 hours stretch. We start with maybe 2 hours, 3 hours, then you gradually increase the hours staying in the school. So that is completely normal and expected, and you should have the child go in gradually. You shouldn't just leave the child at the crèche completely for a whole day. The child is going to cry. That is completely normal. So but hopefully with time the child will settle. Okay. All right. All right. I think yeah. Okay. So let me go back to Facebook. I've answered the Instagram people. I got a question from Nengima Natok. I hope I pronounced your name well. Apologies if I didn't. Thank you for all you do. My baby is 27 days. Okay, she's still a newborn baby. Birth weight is 3 kilos. Currents not known. Okay, on EBF. Suck at every given opportunity when she's awake. She wants to suck and stay at most 30 minutes. Why is 1 hour? If you decide to insist on not feeding her, she's not allowed to suck. She cries. So there's nothing wrong with a child who wants to suck all the time. That is absolutely normal. Okay. And so there are many reasons why children suck, and I think it's important for parents to realize that. So babies don't suck only because they are hungry. Okay, it's one of the things mothers or most of us think babies are sucking because they want food. No, that's not the only reason they suck. So they suck also for pleasure. Okay, they suck for comfort. So sometimes the baby just wants to be close to the mother, and they know that's the only thing that will get them quick access to the mother. So they hold on to the breast because they actually just want to be near you. and they want to feel that emotional warmth, of their mother. They want some comfort. Sometimes they're basically using it like a pacifier. So then, because sucking is actually something pleasurable, so children enjoy sucking. For example, for us as pediatricians, when we want to take blood sample from children, we don't want them to feel pain. We get them to suck on something. We get them to suck maybe on glucose or whatever. So it's something we use. So sucking is something that is pleasurable for children. And so when you are taking their blood sample, they are sucking, they won't even feel the pain. So it's something we use. So it is completely, absolutely normal for babies to suck. It does not mean the child is hungry. Okay, that's number one. And then number two, a child does not need to control you with crying. Children are going to cry. So the fact that if you take the breast of the child cries does not mean it's not the end of the world. So a lot of mothers seem to worry that if they don't do something, the child cries. There's nothing absolutely wrong with the child crying. Okay. Children communicate by crying. So that's the only language they're going to speak in that first 1 month of life. So it's okay if you think you fed this child, the child is full, and you want to obviously put the child down, you want to do other things. It's okay for you to put the child down. It's okay for the child to cry. Okay, the child will cry and stop. And also the child gets used to that information that okay, if I cry and my mom already, there's nothing else making the child to cry apart from the breast, you just leave it, and the child is not hungry, so there's nothing wrong. After a few minutes, you can still comfort the child without having to put the breast in the mouth. That's the point I'm trying to make. So there's nothing wrong with all that. These are all normal parenting. Okay. Most children within 10-20 minutes, they've already taken all the breast milk they want from the breast. All those extra sucking for 30 minutes, 1 hour is just sucking for sucking sake, for other reasons, pleasure, warmth. I want my mother, I want the security that my mother is not running away. That is all that one is all about. That is not about food. It doesn't mean the child is hungry. It doesn't mean the child needs more food, because a lot of mothers panic about that. And this is one of the commonest reason why some mothers don't do exclusive breastfeeding, because then they grandparents, the other experienced mother started, oh, this baby is not full, oh, this baby is not full, go and buy formula. No, that is not why. If baby is full, baby can be full and still be sucking. Okay, so that's not an excuse to say, okay, let me go and get formula. Maybe it's not getting enough breast milk. The way we know your baby is getting enough breast milk is the weight. It's not the how many hours they stay on the breast. It's not their crying. It is their weight gain. That is the objective evidence that pediatricians will use to know that your baby is getting enough breast milk. Okay, so I think I've answered your question. It's completely okay if you finish your. Sometimes the babies will even, they'll be so full they are vomiting the breast milk, but they will still want to keep sucking. So it's not because they don't have enough breast milk. So, and it's okay for the baby to cry. Stop getting upset about baby crying. It is the language they speak. So there's nothing absolutely wrong with that. So they can cry when they're happy. They can cry when they're tired. They can cry when they're sleepy. They can cry when they are wet. They can cry when they are hot. They can cry when they are cold. So saying because your baby cries is what should make you to keep doing what you don't need to do is really not an excuse. Babies are going to cry for many, many reasons. So don't feel guilty or feel controlled by the baby's cry. You are the parents, so the baby crying doesn't need to control you at all. So also make sure when you attach your baby to the breast, another thing I really need to emphasize is that your baby is well attached to the breast, because I can see this baby is still a newborn baby. The baby should not be sucking on the nipple. Another reason why some baby keep sucking and sucking is because nothing is actually coming to their mouth, because they are not sucking properly. So they make sure that when you put the baby to the breast, they are well attached to the breast. This is why some mothers have what we call nipple sores, and they have breast abscesses and wounds because the breast gets engorged. So baby is sucking, but the milk is not coming out. It's because most of the time babies are sucking on the nipple. If you're having sore nipples or wounds around your nipples, your baby is been sucking on your nipple and not the areola. So the milk is not in the nipple. The nipple is more like a pipe for the milk to come out. The milk is actually stored under the areola, that black part of the breast beyond your nipple. That is where your milk sinuses are. So that is where the baby should be putting their mouth. Even when you want to express breast milk, that is where you press. When you press in that area, you will see the breast milk gushing out like a tap. But if you just press around your nipple, nothing is going to, it's actually nothing is going to come out, because you're actually blocking the nipple, blocking the pipe in the nipple that will allow the milk to flow out. So make sure your baby is well attached to the breast. So lactation is 99% attachment. If you don't get the attachment right, you're not going to get breastfeeding right. So it's something we need to do, and a lot of mothers don't pay attention to that. So when you want to breastfeed your baby, make sure the babies open their mouth wide. In August, we'll come to breastfeeding week again, so we'll go through the whole teaching all over again. Make sure their mouth is open wide, and make sure you put most of the nipple and the areola in the mouth. So when your baby is well attached to breast, you should barely see your areola at all. You should barely see that black part of your breast beyond your nipple. You should barely see. Most of it should be in the baby's mouth. So make sure the baby is well attached to the breast, because babies, when they suck on the nipple and there's nothing flowing out, they also get frustrated. And the difference in this case is that the baby will actually be crying as they're sucking, because as they suck, nothing's coming out, they will cry, and then they will try harder on the nipple, and that is why mothers end up having breast sores and nipple sores. So make sure that you attach your baby well to the breast. And then you're talking about diaper soaking. See, your message is too long, so it has been cut off after the diaper soaking. So that's why I say you try and keep it short, so you can break it into two and send the rest. So diaper soaking is dependent on many factors. So it depends on some type of diaper that you use itself. Some diapers are so hyper dry, so they, even though the child is making a lot of urine, it will always be looking dry, because the kind of material things you use in it. Number two, the weather. If the weather is so hot, the child is not going to make as much urine, because the child body is going to conserve water, because they've sweated already. So they've lost water through sweating. And especially some of us that cover our baby too much. And really, Nigerian mothers, we like to cover newborn babies because we believe that hair should not enter inside their body or something like that. I don't know why, but that is actually not true. You dress your baby according to the weather. If the weather is hot, wear light cotton wear so the baby, it's not written in the constitution that they have to wear cap, or they have to wear socks, or they have to wear mittens. You don't need to put all those ones. If the weather is cold, yes, you don't want the baby to keep warm, so that is when all those are necessary. If it's hot weather, right now the weather is hot in most places. We're in summer, so definitely you should not overdress the baby, because baby will sweat a lot. So a baby that was sweated a lot is not going to make as much urine, because the body has to conserve water for the child. So those are all the factors. So we don't use wetness of diapers or things like that to determine how much baby is getting. It can be helpful, because the more wet diapers, there's a lot of liquid going in. But the most important thing is the weight of the baby. That is the most objective evidence of it, because that one, your baby can never gain weight if your baby is not getting breast milk. Okay, that is very objective. Like I said, urine can be affected by weather condition and all that, and then sucking. The baby can suck for other reasons. So everything is not about breast milk. So there are so many other reasons. So, but the only one that has no other explanation is the weight gain. So baby who is gaining weight is getting enough breast milk. That is how we know, and that is what we pediatricians use. So that is that. And you're also talking about pooing frequently. Yeah, babies who on breast milk, they don't have to poo every day. They may not even poo for 2 weeks. That is also normal. So it's nothing to worry about. So yeah, there's nothing wrong with that. The poo is normal. They may not even poo at all for 2 weeks. So that is also not something we worry about. That is completely normal for babies on exclusive breastfeeding. So I don't know, are you a first time mom? Because your questions sound like that of a non-talk. You must be. I'm wondering whether you're a first-time mom. So first-time mom, we tend to get multiple questions rolled together into long paragraphs. So if you have, we do have lots of resources for first-time mothers, to help you with through all this as well here. But we'll see how that goes. I hope I've been able to address all your questions. If not, feel free to still put. Okay, I didn't post the second part of your question, so but I've answered them. Yeah, but feel free to still repost them if you have any part of the question I've not answered. So that is that. Yeah, poo doesn't have to be every day. Baby can go from pooing up to 12 times a day or to not pooing at all for 2 weeks. So it's a wide variation, and all of them are still within normal limits. So nothing to worry about. Okay, I got a question from Oluwato Singh. Let me see. You have a sister who gave birth to twins 1 month ago. She's not producing enough breast milk for the babies. They're being fed with formula and other baby food. Which one is other baby food at 1 month? Apart from formula, is there any other baby food? I hope they're not giving them cereals. So please, they should not give them cereals. I believe that you can exclusively breastfeed twins. Twins can be exclusive breastfed, and if you come to ATP, you will see our twins that have been exclusive breastfed. Breastfeeding is from your brain. It's not from your breast. The breast milk is made from your brain. There are hormones that control breastfeeding production. So if you are a mom of twins and you believe you can exclusively breastfeed your baby, you will do it very well, conveniently. So, but a lot of mothers already, like, even for those who have one, some of them believe they can't breastfeed them. Not to talk of those who have two, those ones are even like, no, 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 it's impossible. And so because of that, like I said, any little challenge during the breastfeeding journey, people just always want to rush the formula. I said the formula always solve all the problem. It doesn't. It does not. And the best way to still feed your baby is to breast milk only. So I would really appreciate that if mothers have difficulty with their breastfeeding, they come back to us, the pediatricians. They come back to the nurses, to the lactation consultant, and ask for help. Don't listen to people around you, because most of them just always want to quickly tell you you can't do it. And once they tell you, you start having doubts, you start doubting yourself, you start producing what we call stress hormones, anxiety. Stress hormones actually reduce your breast milk production. So this is a problem. So, but if you talk to us, the doctors or the nurses, the midwives, the pediatricians, we are going to encourage you. We are going to be in your corner. We are going to tell you you can do it. We are going to help you figure out what is the problem. And then we try and address it. We have all these breastfeeding videos on our Facebook group and page. You can watch them, so you know all the things you can do. And I found that when mothers know they can do it and they are prepared to do it, they do it. But when mothers already have doubts or fears and worries, and they are surrounded by people who are telling them, no, don't stab the baby, or you can't do it, so they won't be able to do it. So breastfeeding is from the mother's brain. And always tell them, if you want to do it, you can do it, but the best way to still feed your baby is exclusive breastfeeding. If you know the benefits of breastfeeding, then you're going to do it, because it's not only for the baby, it's also for yourself as a mom, and also for the country. So there are so many things which, like, come August, we'll go back and talk again about breastfeeding. We do that every year. So I will not want to go into the details now. But please, they should not give the baby cereals or any other baby food. If they can't do exclusive breastfeeding, then they can do the formula. That is the next appropriate thing to do, but not any other baby food, because I'm curious as to what other baby food are you giving 2 months old. They cannot handle cereals or any other food apart from milk in the first 6 months of life. So please, that's very important. Okay, what can she do to increase her breast milk supply? Yes, we have videos on how to increase your breast milk supply. But the summary is what I've actually said first. A mother needs to relax and needs to believe that she can do it. Oh, she does that because it is the message her brain is sending to her breast. Okay, so the brain is telling the breast you can do it. So the hormones that promotes lactation will be produced the more, and then also the more the baby suck from the breast, the more the mother is going to make more milk. So breastfeeding is demand and supply, which is always a challenge when people rush to formula. When you rush to formula, you're actually making things worse because you are reducing the demand for breast milk. And when you reduce the demand for breast milk, then the breast milk production is going to slow down. So when the baby is, you think the baby is not getting enough breast milk, the solution is to make baby to suck more on the breast. It's the baby sucking on the breast that allow more milk to be produced, because the brain gets the message, oh, we need more breast milk, more prolactin, oxytocin, all those hormones that produce that are involved in breast milk production and supply. They'll be producing more, and the baby, you'll make more breast milk, and your baby will be full. But if you rush to formula, it means all those periods your baby is on formula, your baby is not sucking on that breast, then your breast milk production will be lower. It will be reduced. The brain gets that message, oh, we don't need as much breast milk. And if the mother is stressed, she produces what we call cortisol and stress hormones. Stress hormones further reduces breast milk production. So I always tell mothers, when it comes to breastfeeding, relax, relax, relax. It's not because I'm trying to make you feel good, but that is actually, it works because that relax helps your brain not to produce stress hormones. And don't try to stress yourself, try to do all the work. The most important work a mother needs to do is to breastfeed that baby. Every other thing else, other people can do it. They can help you cook, they can help you clean, they can help you do any other thing else in the house. So when people call for omugo, they shouldn't be carrying the baby. That is not their work. Okay, their job is to do all the other chores that the mother that is not able to do, because we want the mother to actually focus on the breastfeeding, because that's the only thing she can do that every other person cannot do. But most time in the African culture is the grandparent, they just want to carry the baby and still stress the new mom to go and be doing all the chores. That is it should be the other way around. The new mom should just sleep, eat, and feed the baby, and let every other thing else be done by other people. So that the mother can focus on the only thing that she can do, which is to breastfeed the baby, which is also why we want mothers to be on 6 month maternity leave. So that is very important. So this mom, she needs to just focus on breastfeeding her babies. The more she breastfeed, the more the milk will flow and she can enjoy it. So that is just what we advise. So it is about making sure baby are attached well to the breast, relax, eat. Mom should eat well. When you are breastfeeding, that's not the time to start trying to lose your weight. You will lose your weight afterwards. Focus on eat, drink. Not that you should eat excessively or drink to eat normal, but drink a lot of water and let the baby suck on the breast. And then that is it. That's how breast milk production increase and remove all the anxiety and stress. So if she can still do it, babies are still just 1 month. So if she wants to do it, she can still do it. That's what I would advise. Um, Expressing and making into a bottle. What do you mean? She does not seem to be helping much. So the solution is, so the way to the solution is not just expressing. She has to make the baby to breastfeed more, and a lot of mothers don't know how to express properly. So there's also a video on how to express your breast milk, or you can use any of the electric breast pump. They are very good. They can help you get out the milk quickly. And if you drain out the milk through expressing as well, more milk will be flowing as well. But the best people that can express that milk are the babies themselves. The babies are the ones that can easily um you know bring out the breast milk from the mother, more than even the formula, I mean more than the breast pump and the rest. So let the baby suck on the breast very well. Okay, and for twins, there are ways you can breastfeed both twins and they can be supported and all those ones. But if she watches all our breastfeeding videos, all those information will be there. Okay, so that's that. So I would just recommend you watch all our breastfeeding videos. So that's that. Okay, our time is going. Let me quickly go to Falasha Day. Is it advisable to stand the 7 month old on my lap? No. Why do you need to stand the 7 month old? 7 month old need to sit. Okay, they should be sitting with support. Sitting without support, that's what we expect for 7 months old. There is no reason to force them to stand. Okay, So that's that. She liked the position. The bones are not strong. It's not about the bones. It's just that it's not. It's nothing's going to happen. To the bones. The bones are not going to break. They are not going to worry about bending. But it's not the appropriate position to assume for a 7-month-old for a long time. And if your baby likes to be in that standing position, we will worry about that baby, because some babies who are very stiff, they are the ones that tends to um, assume that standing position too early, and you can't easily bend them to sit and all that. So if that is happening, if you think your baby feels so stiff and always want to be in an upright standing posture instead of a sitting posture, I would strongly recommend that you see a pediatrician, for proper evaluation. But otherwise, there's no reason to be standing the baby all the time. All right, if I'm longest time, how are you? Okay, nice to have you. You said good evening. My 2 weeks are currently ill. Oh, sorry about that. I've taken them to the hospital. We're asked to run some tests, okay, and given drugs pending the results, okay. I'm having a challenge with my daughter because she eats drugs. To give her is a struggle. After successfully giving her, after 30 minutes, she tends to throw the drug up. If it's after 30 minutes, that is fine. You don't need to repeat the drugs. Any drug that you've given the child and the child didn't throw up after 30 minutes, that drug has gone in already. The second thing the child threw up after that is nothing to worry about. So some children don't like medication. So I actually have an article on our website on how to give drugs to children who don't like drugs. Most children don't like drugs, especially drugs that are bitter. One of the things we pediatricians try to do, at least some of us try to do, you must give children drugs that are nice, that taste nice. Yes. So, for example, I prefer MCAP to the MSO syrup itself. So, because the suspension paracetamol is sweeter than the syrup, that one tends to be bitter. So, before you give the child any drug, you must taste it as a mom. You must know the taste. So that will help you to quickly know whether this is going to be a difficult drug to administer or something that's going to be easy for the child to administer. Sorry, I didn't go back to Instagram. Okay, so I'll come back. Okay, Pretty Debbie, I've seen your question. I'll come back to it. When is it appropriate to wean a child? We recommend 2 years. So I can quickly say that because I don't want your question to run away. It's 2 years. Okay, coming back to the drugs. So we have an article on how to administer drugs to children. Number one, another mistake most mothers do is that you always think that you have to give drugs with food. Actually, you don't have to, except the pharmacists have asked you to do that. So try and not give drugs before, after food or shortly after food or with food. Most time their tummy is so full, so it is very easy to bring back drugs that you give with food. It's better to give the drugs without the food if the pharmacy didn't say it has to be taken with food. There are certain drugs that have to be taken with food, for example, your ibuprofen, things that can affect the lining of the stomach. So that's all those information the pharmacists always tell you about when you should give drugs before or after food. It's important, but most people don't even take note of it. All of us just seem to assume we should give it with food. No. So as much as possible, don't give drugs with food or after food. If the pharmacist has not specifically told you to give the drugs after food or with food, give it before the food. The chances of the child throwing up a drug before food is less compared to if you give them after they are full already with food. So give them the drugs, before the food. So you can give the child a drug, maybe say 6 p.m. and then they can have their dinner at 7 p.m. There's a gap in between. That is easier. Then another thing, that when children are sick and they have so many drugs to take, sometimes the mothers will tend to put all of them together and then we want to give it all at once. Again, that's another big error. Try and give one drug at a time and space it as well. So then I found that it may be easier for you to use syringe to give the children drugs. So you can measure it with the cup or whatever, but use the syringe to withdraw it. The advantage of using the syringe is that you can just drop it a little at a time by the corner of the mouth. So just a little is going to be taking more time to go through the whole 5 minutes or 2.5 minutes that you're giving, but the chances of the child throwing it up is less. So give it through a syringe so that you drop it a little bit. Then you can mix some drugs with some things that are bitter, you can mix them with something that are sweet. So some drugs you can mix with like orange juice, you can mix with the ice cream, you can mix it with yogurt. If the pharmacist said it is okay. So you must find all these ways to overcome these difficulties. There's some children, their tablet, you can put it in your swallow. So the bolus of your bar, or you can hide the tablet inside and roll it with your swallow, or what do you call it, something slippery soup or something, and like okra, away to all those ones, and the child can swallow it better. So something like the anti-malaria, most of the anti-malaria come as tablets or dispersible, so you can actually hide them in swallow or bolus of food, and the child can swallow. If it's a child that can swallow that anyway, or you can disperse it in water and then put a little bit of maybe orange juice, something nice, and the child can take it as well, as long as the pharmacist said it's okay, depending on the drug. So these are little strategies that you can use to administer drugs to children. But some children, no matter what you do, they won't take the drugs, they will vomit it, no matter all these simple strategies. In that case, you have to go back to your doctors and they can look for whether there's something else they can do. Like, we don't like to do injections, but if a child is vomiting drugs, they will not keep the oral drugs down. Sometimes that is the only other alternative that we have. Yeah, so your son is on his drug, but the cough is getting worse. Wake up with. So if your child is on medication and the child is not better, the best thing to do is to go back to your doctor so that they can review the child's treatment, and then they can either change the drugs or add additional drugs, or investigate further again what is going on, what are they doing right, what are they not doing right. So if a child is not better on treatment, just go back to the hospital for follow-up. That is the right thing to do. Okay, my time is up right now, but I'll take the last question by Abisola Jejelola. Good evening. My 8-month-old baby sweat a lot, and also he eats his head and legs when angry. Yeah, if the weather is hot, children will sweat. That is normal. So when you say sweat a lot, you see that the child is sweating when everybody is shivering for cold, then I will worry about that. But if the weather is hot and the child is sweating, that is normal. But make sure you are also not overdressing the baby, because some of us, we dress our baby too much. You wear 2 layers, you wear thick clothes, you wear socks, you wear mittens, you wear cap. Some of those things are not necessary, especially when the weather is hot, especially some of us in Africa, when we can have very hot weather. So just reduce those layers. But if the weather is cold, everybody is cold, everybody is shivering, and your child is sweating, then I will worry about it. And then that's when you have to come and see us. And then we need to check the thyroid, check that there's nothing else that could be explaining why the child is sweating in a normal cold weather. That's what I mean. Um, yeah, so that's it. The child is otherwise well, eating all his milestones, so that's good to hear. But from my own experience as a pediatrician, most babies that sweat a lot is because we mothers overdress them. We wear too many clothes for them. We wear too thick clothes for them because we think we don't want them to catch pneumonia. And it is when hair enter their chest. That is a literal translation from Yoruba culture, that if breeze enter the chest, the child is going to have pneumonia. So mothers always overdress their babies, especially in southwest Nigeria. So no, that's not really true. All those are myths. Your child does not get pneumonia from hair, okay, hand or breeze entering their chest. They get pneumonia from germs, from bacteria, from another person who is coughing, who has chest infection, who is coughing out the bacteria. If the child inhales, but that's how they get their pneumonia, or through their blood. So it has nothing to do with breeze or whatever. So that's not it. So let's not overdress the baby. If the weather is hot, wear cotton wears, light cotton wears, like those singlet, wear something light. You don't have to wear socks, you don't have to wear mittens. If the weather is cold, then you can wear them something thick. So what I normally tell parents, feel the hands of your baby. That's how you know whether they are hot or cold. If you feel their hands is hot, it's warm, it's moist, it's sweaty, that child is overdressed. So take out some of those layers. If the hands are feeling cold to your touch, that child is cold, then you can wear additional layers. So that is how, simple things we can use to guide us to know how should we dress up our baby. Just go by the weather dictates, and so that's what I would recommend. I hope that is helpful for Jejelola. Okay, so I'm ready to answer the question about weaning the baby. So we recommend that you breastfeed as long as possible, but usually 2 years and beyond. Okay, some others feel like they can't do that. Some will want to win at 1 year. So it's okay. Just make sure the child is already well established on complementary feeds before you win. Make sure the child is not sick. Make sure the child is otherwise well, and after your strategy, because a lot of mother will say, I want to win. But then after one night of crying, they will start saying, oh, can I breastfeed the baby again? So I'm like, don't win when you yourself you are not emotionally ready to win your baby. We have an article on simple tips for winning. So, because you're also going through your breast getting engorged and how to wear firm bras, put some cold or hot compress, take your paracetamol and all that. So, you have to also prepare yourself for the winning and you also have to prepare the baby. But do it when you're ready. There's no hard and fast rule, but at least we recommend if you can breastfeed up to 2 years and beyond, that will be awesome. But if you can't, even 1 year, we'll take it like that. We'll manage it. All right. Thank you so much, everyone, for joining me today. I will complete my talk about acute emergencies. I'll talk about the A and the B, airway breathing. So if your child has any issues affecting either of those, please take the child to the hospital. If you still have any question or you are just coming on live, so feel free to go to our Facebook group, post your questions there, and one of us, our professionals or moderators, we will try and answer your question. Like I said, if it's not urgent, we'll try our best. Within 72 hours, we'll answer most of your questions. If your child is ill, very sick, please don't leave those kind of questions on Facebook. You have to bring the child to the hospital to see us so that we can quickly address that. So thank you so much for watching today. I'll see you again next week. All things equal. So have a wonderful evening, and it is bye bye. Bye bye. One àwọn ATP leader wa he died.
Kí ló ṣẹlẹ̀?
She's had this something with her eyes for a long time. But many people ti were okay. But I'm just
Like what is it?
it's like
Nínú ojú ẹ̀.
in fact wọ́n ṣe gbogbo
Scan.
they did MRI, they did biopsy,
Is it
and
like a cancer or what?
but they said it was not cancer. So initially they think it was bóyá kí ló ń pé bóyá it's something like tuberculosis, like ó kàn ṣáà níbi inflammatory growth.
Wow.
She sent me gbogbo right at that point. I even sent her to.
So how did they now know that's what killed her?
Oh, I think she later now had what looked like stroke.
Wow.
And all that. I'm just trying to remember because we were going to send a lot of Ololade about this thing. I sent her to Ololade. I'm just going through all our messages now.
How would I know?
I don't even know. Ó ṣe surgery ní 20. When is this surgery? Abakaliki ló wà nígbà yẹn. I don't know her age. She will be in her 40s or thereabouts.
That's only family.
Hmm.
Really hard for them. I want to go around growth buying because sometimes I'm need the monitoring. Sometimes I'm need monitoring. Especially about the get being determined something then. So that's sad.
Ìyàwó bọ̀bọ́ yìí ní Abakaliki náà ni dókítà ẹ̀ ń gbà yẹn. And Ọlọ́ládé gan, I chatted with him about it. Gbogbo biopsy yẹn wọn ò really mọ nǹkan tó fa growth yẹn.
No light card there, is it still valid? No, she will for
Okay, you have to log into my account. And do you need the hard copy?
Remember your password.
I automatically sign in. Let me.
I also buy a spa experience for Dr. Tosin.
Is it on the? Is it on the blue lights?
Àwọn banner time yẹn.
Are they on net? Let me say, any hard copy. But I have it on my. I have the app. That's why I can give you my phone. But I'm just trying to chat to this person talking to me. Oh my gosh. Only neurofibroma, and eventually I've just gone back to look at it now. Only neurofibroma, and then she now had the paralysis. But then she stopped talking about it, so I thought that she's okay. I guess at that time we could communicate more. But she still posted on our group in January, any March. But that's the only post could just so
about the serious diagnosis going, you may need to have like a watch list kind of approach for them. And have one person in your team, so I might check on them. But because of sometimes when your mind gets overwhelmed because of the structure for those kind of issues and everything. So the thing on your Obama or too much, your too bad thing what tired, there's no system to push it. Or come and follow along the line. It's really hard. This is bad. Are you giving me a card on
There's no card. I have to log you into my account.
Oh, okay.
I can't find my card, but let me. I do understand. And it's so sad. But no, even to we still call her. They do communicate. I have like other leaders to man check on each state.
Okay.
So I even want to chat with them. Why you find my phone? Because I don't want to know what happened. I think she was just so tired of calling her. In fact, the last time I chatted to her, I even sent her money from my personal account because I won't allow speech money. ACP ti send owó sí rí tẹ́lẹ̀ lèmi náà tún send owó sínú àkáǹtì mi. So that was late last December. Then gbogbo year you kò really sọ̀rọ̀ mọ́ ń pa ẹ̀ owó ẹ̀ ń post normally like the usual thing. But I didn't know anything happened. So if anything happened, it must happen between March and April because this girl said she died last month, which is May, and we didn't even hear. When she didn't tell anyone of us, she was even again back in the hospital. I understand why she may not have done that because she's only even by that time because she may not even have the capacity to use her phone or to check things or do all that.
10% of price treatment. Once you join, you can just take 50% of first pack, 10% cafe.
When you join us. Ibi mo ti lọ rí kìíní mi kàn lọ ní ṣé mo join ìṣàbò kan lọ àti gẹ́ẹ̀sì mi rò pé mo join. Why not go and buy the one online?
Èmi fẹ́ lo èlò nìyẹn. No, tọ́nù lórí ẹ̀.
It's a longer time, so if you want something shorter,
The is for when you join, Jerry.
10 minutes is long enough.
And it's so many spoons of sugar will make it sweet.
3.
Really? I feel like you guys are just literally just drink the sugar and forget about drinking tea.
Well, it's lasting longer in January. It's lasting 2 weeks now, the sugar. And usually it lasts less than a week.
That's some progress.
And Daniel is lazy.
I say that I'm 60 something. This one, the nice. Can I pass the table and lower for anything?
Well, that's it's our 50th birthday.
For you can go down there. I will just buy.
There's a much cheaper one, only 60 something or 50 something. Send it to yourself and then send it to her. Where is she? Where is she based? Is she in a place where there's one close to her house? Let us know.
Any day of the week, to want you Monday to Thursday. I just pick any day of the week.
I think my own, I don't even think it matters. It's study for 12 months.
So if it's any day of the week, it's 109. If it's Monday to Thursday, it's 99.
I didn't even know 99 Charlie. I didn't even check it.
Monday to Thursday, yeah. We just go during our leave day. This is 12 months. Huh? Exactly. But that's why I continue on my thing. Since it's a 12-month thing.
It doesn't have, you have to go on a day that and it's 1 hour, so you don't have to go for the whole day. It's
almost 2 hours.
Oh yeah, my lunch.
And lunch 2 hours. Okay, this is just 15 minutes.
So we're gonna change it if you want to and add more to it.
15 minutes.
15 minutes, okay. Yeah, we need couple extra. It's just this part.
But they said it's from 1 p.m. to 5 p.m. It has to be in the afternoon.
I want just all the share to the my own weekend molo. I don't think it's time bound. If you just book the time.
Your own was not time. That's why only any day.
That's what you did for me.
This one is going to be extra £10 for her to go anytime she wants.
£10, I don't matter much. £10 that make a difference between, but it's okay. If this is a 1 year event, only. If it's a 1 year time, money job for Monday to Friday, Thursday to Monday. Money. If it is urgent, I think my own go. I didn't even know how long it is.
It's 1 year, man.
Saturday, the Misha look who's a Misha because join no Moriah. But I don't think it really matters.
Okay. About that part, but about the income.
Which part?
About the.
That's the one. Ọmọ mi dẹ̀ ń lọ. Mo ń lọ massage. Ajá àti màá lọ gbé lóòótọ́. Enjoy you.
Exactly. Just count is in value.
Good living. Wow.
Yeah, I just wanted to find out about the booking I made. Yeah, so I made a booking for the room. 953-33-600.
tia, tia. Yada, 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 yada. Tia, tia. Tiki, 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 tiki. The tiki, tiki, are you done? Yes. Also, here's next one. I wanna watch the world. Adios. Dinner. Adios.
Okay. We don't. How far would you wash that? So let me see if you can help me find the screwdriver. The flat one. You can find like a flat screwdriver. The flat handle.
Okay.
Try and remove this thing.
Daniel. Come on.
Follow up this on there. Where are you?
I can't find the black screen.
So all these bags, I'm coming. I said I'm coming. All these bags started. Put all the ones that are all, they're all over the place. Make sure they're all packed nicely, and then come and put the bags in here. Then by I think next Monday, I will take it to a church on one of the days. Know that? It's not okay, find some. This one will work for that thing. Can you check under here? This glass there. What is it? I can get
I saw in the like a little package. Lord.
There's something that's lighter.
Mm-hmm.
Tester, we call it tester. It's very flat here. You know it.
Nope.
And this one is too wide. It's not fitting into the. It's not easy to turn it. It's a smaller, like a smaller screwdriver, like one of these ones. But it's flat head. It should be like somewhere here. Check. Check this place, brother. You don't know the tester?
No.
You don't know, don't worry, I've got to. Let me find. Okay. Where did you find the one that was
No, it's in there.
in this box?
Mm-hmm.
I thought I had like screwdrivers before, but I can't find them. Fruits will go, buddy.
Why do you need to see me?
Hold on. Okay, well, let's go. Yeah, the one making it now with this guy.
What?
But Daniel is making it.
Making what?
Whatever you're only arranging. Yeah, let's go on your birthday. Not close, so you should go and pass the back. Go and pass the back. So this road is now some construction of
Because there's always one car to go up.
you have to get the ladder and then use the ladder on the show. What? Come back. You don't give up so quickly, man. You have to
I was cool.
You have to be able to negotiate your way around things.
Technically, I was still like
To slide,
no, it's like
just negotiate.
Wait.
Oh no. Eso es lo yo.
All right, 10 more, 10.
Show the other one, yeah. Oh, my name is every day. They're all, I go to it. All the, so I keep in it for my down from the back. Everybody feels okay. There's not lots of people snacks like that. You see people wearing this type of clothes. Well, my she's done. These are all the things we don't work on some part, but when it's fine. But come back then, if they're demons, they'll want to get that. And they all pay, but anyway, òun ló yẹ kó ti ṣe tó jẹ́ kó máa wà very that to be buried inside. What the mom was at least to keep it much for long. Ọkàn ọmọ rẹ̀ bá mi ṣan ẹni kó lọ tó lókun tó pọ̀ wà nípìn ìgbà. Ọkàn ẹ̀kọ́ ṣáàṣì ó ṣòpọ̀. Wọ́n rí kótó ọ̀sẹ̀ kejì. Lọ́ọ̀kì ló kọ́ra. Ó wà mọ́ desperate ọ̀pọ̀ lọ àgbẹ̀ fáwọn òkè kúrò. That is kan tí mo sọ yẹ kó ṣe kí zip yẹn kó wà sábẹ́ bẹ̀yẹn which is gbogbo bí ó ti jẹ́ pẹ̀lú wá débi ẹ̀yìn yẹn sìn ti fi ń pín kéde láti lò. Àgbà tí èèyàn bá yọ ọ̀bẹ̀rẹ̀ nìkan kí ló máa ọ̀bẹ̀rẹ̀ lè fi òkè sí bóyá tó bá fi òkè nínú bóyá ó sì máa dúró pọ̀ dáadáa. Ọ̀gbìn ṣì máa gbà. Àwa ìdè crop looks like this. Ó jẹ́ sọ́lọ̀ bí wà jáde. Ọgbà ní mọ́sítàṣì tó máa fi ṣe é. So you, is it this you've been wearing since 1930 that you went up, we didn't see you just to wear this one next.
I was doing it too much. It's sagging a bit. So
Let me see. Let me see the top. Get our trouser, but like make the length added extra length. Because you might get down trouser. Bóyá measurement mo bóyá the way they should measure it because I measure from here. Bóyá because I always measure from here. Maybe we should have been measured a little bit higher up.
3 more minutes and that's it. Shouldn't be playing games at 9 p.m. Your classmates. I told you that before. Yeah, that's it. Remember what your pajamas? Let's wind down, wash the plates. Let's wind down, wash the plates. You think you won't come and test all your clothes? I'm only bought for you. Please let me bring my phone.
Which phone?
The brown one, the one with the brown.
Okay.
Let me help you take this shirt off. helpless. That's the easiest bit. Struggle. Thanks. Listen. Take this. Wait. How many? Who's? His face. Laying the size. So I think this one should be easier.
Go downstairs, bro.
They're not better little room. Why should I? Anyways, you've been spending too much time with that little foot.
I have not touched my phone. I was just charging it.
Sure.
Yes.
Whatever keeps you happy, bro. But look at this.
Put it on properly at least.
Yeah, that's property. You don't know what to put on the feeder. Let's see how you put on there. Let's see how you put it on. This is how you put it on. You don't wear it like that. You wear it tilted down. Oh, look. This, you cannot tell me that this looks better to you than this. This is way better. Yeah. And see your proof? This shirt was that shirt, oh my goodness, that was the pain of my existence.
Why aren't you going outside, bro?
Well, it's not even your birthday, and that's bad. And it says it's like, no.
I need to wear my other one. Let's go. Whoa. Hey. Stop saying after me.
I didn't go. I'm just running up the stairs, bro.
Jeez. Jeez.
Oh my!
What?
Nothing.
What did I do?
I just thought something fell.
Huh?
I just thought something fell. I was like, what? Like, just invest. So.
That's what I'm doing.
Where are you going?
Stop lying. You're literally just using your phone. I saw the tapping. I could hear the tapping, actually.
Well, just it's late.
And you will admit it.
Alright, fine, I didn't use my phone now, so what?
You shouldn't.
Alright.
How you move?
What are you going to do, man?
Avoid that end of your business.
So, why would
I'll just have some. Too late. I was gonna pee on you, by the way.
Bro.
Because then you need to use a toilet.
Mm-hmm.
Why are you waiting for me? Creep.
No, I'm not doing it.
The way you're breathing out is like here. Look at my freshly washed hands. You probably don't even wash your hands.
I do wash my hands
How many times?
every time.
Since when?
Since the start of May.
No. Well, since I told you that you should wash your hands, I was like, February. That's when you started washing your hands every time. Daniel, why are all your clothes on your bed? Can't you fold them properly and put them away? And you're going to sleep on them and make them dirty. So you have to pass them down if you're not going to fold them. At least pass them in one corner tomorrow you fold all of them.
One thing, at number 5 is Bangladesh. Around 7% of Bangladesh is covered by rivers and waterways, earning it the nickname Land of Rivers. And number 4 is Canada. Nearly 9% of Canada's total area is covered by freshwater lakes, and it has summer be like it's too freaking hot, fall be like it's too freaking windy, winter be like it's too freaking cold and windy, spring be like it's not too hot, not too cold, not too windy, not too rainy. Oh, that was wholesome. I didn't expect that. Allergy, summer be like. free. Just because it looks free for you. Instead, let's start with blue. And I promise I have results that we all cut across free. Since we work here, but that looks black. So let's not use free. Let's all instead, let's use color here. And I know what you think. You get complimentary contrast. But not this time. This time it's about color temperature. But a little blue in the darker area. That's because shadows are cooler. But wait, because we want to blend and warm yellow from the left side and blend along the leaf direction. That gives you a nice texture and realistic pattern. So, color brought let's hope we can put a smile on that young man's face by the time we finish. And the pressure keeps coming. Just right back in there. Everyone says that China claims Taiwan, but no one talks about how Taiwan claims China too. See, when the Chinese Civil War ended, the PRC established their government on the mainland, while ROC fled to Taiwan. Since then, both governments claim to be the legitimate government of all China. However, the reality about Taiwan claiming China is kind of confusing. You see, Taiwan's constitution was written before the Civil War ended, and at that time, the ROC still ruled every single inch of China. But when they retreated, they didn't create a whole new constitution saying we only represent Taiwan. Today, Taiwan rules itself. Well, so everyone says that China claims Taiwan, but no one talks about how Taiwan claims it too. See, when the Chinese Civil War ended, the PRC established their government on the mainland, while ROC fled to Taiwan. Since then, both governments claim to be the legitimate government of all China. However, the reality about Taiwan claiming China is kind of confusing. You see, Taiwan's constitution was written before the Civil War ended, and at that time, the ROC still ruled every single inch of China. But when they retreated, they didn't create a whole new constitution saying we only represent Taiwan. Today, Taiwan rules itself, while Beijing claims that Taiwan is a part of mainland China. But if Taiwan drops its claims and goes for independence, Beijing will likely respond to it. So everyone says that China claims Taiwan, but no one talks about how Taiwan claims China too. See, when the Chinese imagine waking up and the world isn't divided by countries anymore, but by a system no one understands. 4 equal zones cover the planet. One is the safe zone. The other 3 are the red zone. And the red zone doesn't warn you. It doesn't spread. It just wipes you out. You have 1 hour inside the red zone, and then you're gone. Every 24 hours, the safe zone shifts. At first, it's panic. People don't know where to go. No one knows where the next safe zone will appear. Every decision feels like a guess. But then, people start noticing a pattern. The movement isn't random. It repeats, predictable, like it's following fixed paths across the planet. So instead of chasing the safe zone, people change strategy. They move to the edges, because the safe zone usually moves into a neighboring zone, not across the entire map in one jump. So the most valuable places become the lines between zones, and especially the one point where all 4 meet. That center becomes the most crowded place on Earth. From there, no matter where the safe zone goes next, you're never far. Around it, along every border and around the center, tighter, denser, closer than ever before. Oh, and don't forget, there isn't just one center. There are two, exact opposites on the globe. And instead of one safe point, the world splits between two. Imagine waking up, and the world isn't divided by countries and the only way to beat the global change is by simply walk around it. Something to say. The next stage is going to be a little harder. You want to just stick my head in there? This is what I can simply by tap. Oh, my goodness. No! Now she's walking in. So it's allergic to this. It's simply like running behind you. We are looking out to walk around it. Yes! Now all that remains is the final stage. More issue though. Is it walking? Oh, I just couldn't do it. I spent 20 whole minutes and I had no success. And so I started trying some different methods. At first, I tried to listen to Ella Tracy's brain rocks. But it didn't really work. So I tried the next best thing. Pretend that I was Jack E. Fields. This is a two-side wall. And the only way to beat it is by getting to the other side. Watch this. But in the end, only one song actually helped me. Don't forget your balls. This song has been a power up. The only way to beat the purple game is by simply walk around. In this case, don't miss the same. And so the next stage, it's going to be a little harder. You want me to stick my head in there? This is what I can simply by tap. Oh, my goodness. No! Now she's walking again. So it's allergic to this. It's simply glide around and running behind you. We are looking out to walk around it. Yes! Now all that remains is the final stage. What more is you know? Is it walking? How did Luxembourg's territory change over time? Luxembourg was once part of the Holy Roman Empire, and they were a very powerful duchy at the time. So powerful that several Holy Roman emperors were Luxembourg. But Luxembourg was soon conquered and spent 400 years under foreign rule until it regained autonomy after Napoleon's defeat. They then joined the German Confederation, and Prussian troops came to defend Luxembourg City. In 1830, Belgium rebelled against the Netherlands and took over half of Luxembourg, but they couldn't attack the Prussians in Luxembourg City, and Luxembourg was forced to give up the territory. In 1867, the Dutch king wanted to sell Luxembourg to France, but this made Germany angry, almost leading to a war. Luxembourg was instead made neutral. During World War I and World War II, they were occupied by Germany, but were returned after both wars. Realizing that neutrality can't protect them, they became one of the founding members of NATO and the European Union. How did Luxembourg's territory? Don't rail no more. Let's play football. It's World Cup time. Let's go. World Cup. Everybody jump It's World likely older than most of you guys. It is still super active about it, even when the game hasn't been nothing. Plus, with its really easy gameplay of Red Light Disaster, honestly, I would be surprised if the game is still active 100 years later. But others, I'd say, we're going to beat it. For a game that was created in the ancient era of 2009, the game is still beloved by many people. Maybe it's free to make or the occasional funny moments that keep people playing. But whatever it is, the game will still definitely be around for a long time. But I know for a fact that the Roblox game that will probably outlast every other game on Roblox is the Roblox games you can remember now. Lots of you would say naturally as inspired. You are 100% correct. For a game that is likely older than most of you guys, it is still super active nowadays, even when the game hasn't gotten any major revamping. Plus, with its really easy gameplay of Red Light Disaster, honestly, I would be surprised if the game is still active 100 years later. But others, I'd say we're going to beat it. For a game though, hey, let's do it here. So we're doing something crazy. So we're going to be banning social media for kids under 16. The way you're doing it is it actually official. If a prime minister here's comments that yep, we'll get a ban and that a full ban is the right choice. So what are you banning, like Instagram and TikTok? Oh, Instagram, TikTok, Facebook, Snapchat, YouTube, X, and even streaming services like Twitch. Was it that anyone under 16 will be banned from live streaming themselves? Also, from other features, but they did not specify what will be. I need to. You're really copying me. Help me out, right? I also have another great idea that you didn't do another thing. So we're going to put a night curfew for anyone under 18 so that we can better this is fine. Hey, let's do it here. So we're doing something crazy. So we're going to be banning social media for kids under 16. The way you're doing it is it actually official. If a prime minister here's comments that yep, we'll get a ban and that a full ban is the right choice. So what are you banning, like Instagram and TikTok? Oh, Instagram, TikTok, Facebook, Snapchat, YouTube, X, and even streaming services like Twitch. Was it that anyone under 16 will be banned from live streaming themselves? Also, from other features, but we did not specify what they'll be. You're really copying me. Help me out, Australia. I also have another great idea that you didn't do another thing. We're going to put a night curfew for anyone under 18 so that we can better this is fine. Hey, let's do it here. So we're doing something crazy. So we're going to be banning social media for kids under 16. The way you're doing it is it actually official. If a prime minister here's comments that yep, we'll get a ban and that a full ban is the right choice. So what are you banning, like? Well, like every other video that I make, I always get comments saying, was this a this thing reference? And 90% of the time, I have no idea what they're talking about. They hit it with a sonic boom. No, guys, the sonic boom isn't a sonic reference. The sonic boom is like an actual real-life thing, and this Attack of the Waters does. If anything, Sonic is a sonic boom reference. One comment I get quite a lot is Alan Mecha reference. Who's the guy that makes the animation version of Minecraft videos? And also uses the same stuff that I use in all my videos. You guys do realize this is a, Minecraft song, right? Like, this is a music that's called Kickstart. You guys know that, right? When I made the video about the Minecraft gauntlet that I did, apparently the word gauntlet was a reference to Geometry Dash. Is that like a Geometry Dash hack or something? Actually, for a matter of fact, that was apparently everything a Geometry Dash reference. I talk about Dougal, it's a reference to Ducky, who's a Geometry Dash YouTuber. I talk about someone clicking fast, and I get thousands of comments talking about Geometry Dash. they punch. Oh, ow. I'm gonna bait it. Alright, here we go. Hey, no. There's no way. You are now go up. Alright guys, cheaters might be completely angry after the new Roblox update. Let me explain. For years, hackers, root drivers, they would get mad, made a new account, and came back the next day with the same cheats. Roblox knew this was happening, but they didn't say it because they were terrified of banning rigid players by accident. But something completely came out. A new Roblox update dropped out of the blue. It's a new fan API with one game-changing feature, device blocking. When lost defense, a hacker now, he can flip one switch called apply device block, and that's it. The hacker's entire phone gets locked out of rivals. Not just the account, the whole device. That means making an alt does nothing. Same phone, equals same band. Is this the rivals comeback that we wanted? Alright, I shower at night. That's what it clean. Not sure. I shower in the morning, which means I sweat all day, I get dirty all day, I come home and I'm dirty, and I smell like crap, and I go to bed dirty, and I wake up dirty. I don't know what to shower, but when I do, I use the Men's 13-in-1 shampoo, 72-in-1 shampoo, the full Doritos body wash collection, of course, the 365-day deal. All the best products. I shower at night. If America and Canada united, the first thing that would happen is the creation of the biggest country in the world, covering almost 20 million square kilometers, even larger than Russia. Together, they would form a superpower like no other. Canada's resources, like oil, timber, and minerals, would strengthen the U.S., while America's industries would make the new union even richer. Canada's small population of 38 million would barely make a dent in the combined total, but their land and Arctic access would be a game changer. With control over the Arctic, the U.S.-Canada union would challenge Russia for dominance in the region. Plus, the world's biggest economy, now over $26 trillion, would completely reshape global power. However, merging these countries would be easy. Cultural differences, healthcare systems, and political disagreements can create tension. But if they pulled it off, the combined nation would be unstoppable. Would the world cheer this union or fear it? That's the real problem of America. So is the most people in jail. Oh, they say we have a lot. We have 8 people in the whole country. Yeah, well, that's like nothing. We got like 140 people. They're taking only 140. We got 35,000. Whoa, okay, that's a big jump. We only got 40,000 here, which is pretty good for the amount of people we have. It's pretty cool, Japan. We got 63,000 people in jail here. I have one probably for like they mentioned my Apple people are going to join them. They realize I have that much. 4,000 people in jail. You got to make a spot that people are putting in your gym, fans. We got stuff. Okay, we got a bit of a jump here. We got 108,000 people here in jail. Oh, you're very close to Pakistan. We got 109,000 people on the Salvador. Not much. Yeah, we have like all the gang members here. We have a lot. Like 120,000 people on the Salvador. Okay, ready for the jump. We got 433,000 people in jail here. There are probably people just looking against women. Not all of them. Maybe 4 of them stole something. We got 530,000 people in jail here. Oh, we got a big population. Okay, compared to population, it makes sense, I guess. For us, we got 909,000 people in jail here. Population is a lot less than Israel. Yeah, not much. So we have a lot of games. So for us, 1.7 million. Are you serious? Yeah, but again, our population is huge. Yeah, we got the same population. Why are we 2 times higher in you? Well, I don't know about that. Okay, so China's the most country. They got the most population. For some reason, they're estimated at 6 million. I'm here on the U.S. 1 billion a day, 133,000 people in jail. U.S. City population is 5 times less than Britain. We're most gangs. They don't have to do it. We don't arrest people for putting right out long pizza. Yeah, but we have a lot of it. That makes sense. So it's the most people in jail. Oh, I didn't say we have a lot of them. Hey, good. Your list of phrases that are going to be said in the next Minecraft movie. You're supposed to be a hero, Brian. Easy S tier. If they say this, the theater is doomed. I'm Steve. What's your name? Oh, I'm Pixel. I Pixel. This one is so stupid. I'd give it like a B tier. I think the chances are low. Is everyone safe? No. Dream was taken. Again, easy S. People will freak out. And honestly, fuck the tier list. I'm just going to name something I think have a tiny chance. I don't know how to do redstone. It's a bunch of mumbo jumbo. Hey, you're tough. Let's kick it up a notch. What's your name? Jenny? Fine. Man, that was a pretty weird tree. There was a guy named Tommy in. Building with y'all has been fun, but does Minecraft have some kind of story mode? Steve, what are you doing? You know we don't mind it, not. Your list of phrases that are going to be said. Was it crazy bad? It was over the wall.
Yeah, it was okay, but I'm excited for Jordan versus Austria. Yeah, Saudi versus Uruguay is gonna go crazy. Dude, how are you gonna say that with Canada versus Qatar 3 days later? No, let's not get it. Which country? Me, I'm from Palestine. You know, which country are you most excited to see play? Palestine? Palestine is oh, then Jordan. See, told you. He's just saying that because he's Palestinian. No. Then which country? Saudi Arabia. Told you. No, he's just saying that because they grew up with Saudi. No, that's not the. Then who do you think is winning the World Cup? Palestine. They're not. I'm not watching football. It's a crazy surprise.
These are all viable ways of jumping to crane and construction and focus rivals because being on top of the crane and rivals has three solid advantages. First, it has maximum aura. Second, you can trick shot from the top third. If you're low HP, you can hide from your opponents. So let's look at some easy ways of jumping across first and hook up a 3D play weapon at the end. Starting with the subspace trip, just place it down and jump across. It's really a no-brainer, but since it's pretty expensive, I only rated these 6 out of 10. It also works with the trowel, but since the trowel jump is a glitch, it's very inconsistent. That's why I wouldn't recommend it, especially for new players. Now you can also use the grappler, which makes it even faster, but you would have to buy the entire idle pass. Just for one small jump, it's way use the free-to-play method with the grenade instead. Just stand here and wait until the grenade trajectory comes closer. Now time your jump and go on top of the frame and ease up.
Anyone want to hire me? Anyone want to hire? Career day with Nickel and Breakaway. Oh, now there's one. It's not a matter too. On the third time, look like third healthy. I said, right foot, creep, boom, on the foot, anyone want to hire me? Anyone want to hire? Career day with Nickel and Breakaway. On the third time, look like third healthy. So I might be kind of true. You see, I came across this video of Tracy challenging me for what we wanted to do the game. And normally this would be great because you guys have been asking for collab a lot. The problem is she actually plays the game. You see, online uses 4 hours of time. Meanwhile, she won't be interviewed and is actually better than all of me. So it's not that much. I'm okay at hobbies, and I can do at least one more month. So I can probably look though I might be kind of screwed. That's no way. I'm 180 pounds, and you're over 350 pounds. You eat free. Why am I running from here? That's not great. I still. But it doesn't end there. Everything changed when Speed said, I think I got something. Don't worry about People are accusing me of lying in a recent video where basically I showcased a bunch of real-life apples and did a deep dive into finding out which apple is the Minecraft apple. And the reason why I did this was because one day I was shopping for apples and saw these bright red ones. So I bought them for me and my wife and daughter and then took a bite myself and was shocked to find out that not only were they delicious, but they were red on the inside, which gave me the idea to make a video testing out which apple the Minecraft apple was. Because when you eat an apple in Minecraft, you only see red part, meaning the entire Minecraft apple inside and out is red, just like the apple I found in real life. When I made a video showcasing this, half the comments are telling me it's a tomato. Like, bro, it's a tomato. Where are all the tomato seeds? And why does it taste like a beautiful, organic, perfectly red apple? People are accusing me of lying in a recent video where basically I showcased a bunch of real-life apples and did a deep dive into finding out which apple is the Minecraft apple. And the reason why I did this was because one day I was shopping for apples and saw these bright red ones. So I bought them for me and my wife and daughter and then took a bite myself and was shocked to find out that not only were they delicious, but they were red on the inside, which gave me the idea to make a video testing out which apple the Minecraft before we over 2 weeks. Well, how the big deal in just 2 weeks.
need to get him out. Do we? What? Do we need to get him out? I mean, I guess not.
Yeah, it's never fun. $1,700. Sorry. Oh.
Very great.
Entering Japanese cat cafe. Employee stopped me immediately. Employee one roll me. Okay. Employee orange cat. People from France. Me. French. Employee good. I sit down. Cats everywhere. Peaceful. Adorable. Therapeutic. The gigantic orange cat jumped on the table. No like retired wrestler. Cat staring at me aggressively. Employee watching nervously from distance. Me. I thought he only hated French people. Employee. He improvises. Cat slowly pushes my drink on the table while maintaining eye contact. Me. This is targeted. Small child nearby points at cat. Child. How I'm evil. Employee. No. He's just passionate. Cat suddenly climbs onto my lap. Starts purring violently. Me. Wait, he likes me? Employee shocked. Employee. Impossible. Another worker comes over, then another. Entire staff now observing me like chosen prophet. Manager arrives. Manager. He has never trusted customer before. Me. What does that mean? Manager bows slightly. Manager. You must take him. Me. Take him where? Orange cat already asleep on me. Employee quietly bringing adoption papers. Me. I came here for coffee. Congratulations on me. Entering Japanese cat cafe. Employee stops me immediately. Employee one roll. Me. Okay. Employee. Orange cat bites people from France. Me.
I just realized what the heck the Japanese cafe is. Cats and all the home shelves and clean them up. Oh, dude, you really likes you. Then you should take it. Right now, I should.
I sit down.
Explain. The top of the minute. It's been a while since I've handled a fresh pair of nuts, and I think it's time to treat myself. So today we're unboxing a brand new pair. Actually, 3 pairs. First up, look at these. Beautiful. The second pair, also stunning. And then the one I've been hunting down for what feels like forever, the Hamato, or the toad head. Finding a good pair of Hamato is like finding a parking spot at Costco on a Saturday. But here they are, finally in my hands. And now I just need to put in the work. Rolling these every day, building up that patina, and hopefully in a year's time they'll look just like my well-seasoned everywhere. From pale and choppy to deep, rich gray. So if you want to start your own walnut journey, the link in this video has got you covered. Go check it out and grab yourself a pair of nuts. I've been playing with this pair of nuts for a year. Hey, what's your deepest, darkest secret? Hey, look at what? Hey, how much do your leaders how much do your leaders make? Well, American dollars, our president makes $22,000 a year. Are you serious, China? Yeah, our prime minister only makes $30,000 a year. Our president makes $140,000 a year. We pay our prime minister only $60,000 a year. We pay our prime minister more $300,000 a year. Well, that's a big salary. Yeah, it's our prime minister. Well, the president of the United States gets $400,000 a year. Well, that's actually a lot. Yeah, because they do stuff on the stock market as well, even after all that money. We pay our prime minister $1.6 million, so that we're no corruption. $1.6 million? What? Why not much Singapore? Well, they told you we pay them a lot to prevent corruption. Well, we don't have corruption either. Of course you don't. Because how much do your leaders make? Oh, they're show big. Alright, guys, how much? So the World Cup just scheduled what is probably the funniest matchup in its entire history, and I'm honestly still in disbelief. Basically, Seattle's going to be hosting a designated Pride match where the whole city and stadium is going to be rainbow themed in celebration of Gay Pride. And you know what teams ended up being selected for the Gay Pride game? Iran and Egypt. That is right. Out of all 48 teams, 2 of the least pride-friendly countries where being gay is literally illegal are now facing off in what is arguably the gayest sporting event of the year. Apparently, Egypt is already complaining and trying to push back on this, but I don't think they're going to be able to do anything about it, and I'm all for it. I cannot wait to watch this game and see how awkward that wedding ceremony is.
You know, Egypt and Iraq are like doing the thing, huh?
You guess what year this map of flags is depicting? The first thing that I noticed was this flag of the Qing dynasty instead of the modern Chinese flag. This means this map is depicting the world as it was over 100 years ago. But since Japan controls Taiwan, it must be after 1895. Next up, notice how Sweden and Norway are merged. There used to actually be a union between Sweden and Norway, which champion in 1905. So the match must take place before that. Since the U.S. controls the Philippines, it must be after the Stationary War. But Australia doesn't yet have its independence from the UK. So the match must take place before 1901. Now check out how Nigeria is split up into a northern part and a southern part. These protectorates were set up by the British on January 1st, 1900. And since Australian independence was on January 1st of 1901, this match must take place sometime during the year 1900. I think so. Check out the flag of Ecuador. See what has the coat of arms on it? Well, before October 31st, 1900, it didn't actually have a coat of arms. But the fact that it's here on a map means the map must take place after that date. So the map must be sometime in November or December of 1900. Can you guess what year this? Great. Great. Just in time. My beautiful assistant, Max. Is this your girlfriend? Yeah. Interesting. I need 3 volunteers. Good. Well, get up here. All right, Max. For $1 million. Which is your girlfriend? We'll find out after the break. I thought you had 3 clicking out of the doctor's walk. Can't find your partner? Find yourself. Welcome back. How do you feel? I like to phone a friend. Phone a friend.
The wireless customer you are calling is not available.
You don't really know anyone.
I know my girlfriend. Hey.
Wrong. B. Wrong. Then it has to be C. Wrong. Then which one is it? None of them. And none of them. My virtue is not here.
Your version. I'm not a version of a person.
Been a long time since I've seen you.
We have a winner!
What?
Say what? You can't swim. Why did you bother the teachers coming out to them?
Hey, you told her to ask what he's using an attitude. Can't you swim properly?
What are you talking about, weirdo? I'm gonna take this from you. Stop it. Don't do that to people who can't swim. You need me to teach you boys a lesson. Oh, I see. Sorry, you guys. What is this? He floats on water without even having to try.
That's awesome. I've never seen anyone float as nicely too.
He's a pro floater. I want to do it too. Say what? You can't swim. This is why you should be. It's the lowest time to kill. Play in Roblox Rebels. I tested and ranked every single melee item, including the new spear. After this video, you know which melee is the strongest and which one you should maybe not pick for your next ranked match. Starting off with the shield, it takes the bottom spot at your left. And since it only does 25 damage, this literally takes forever. Side lands in the 10th place. It's a movement item, so it takes longer, I guess. And the ball comes in at number 9. Fun fact, no one uses this item. The katana secures the 8th spot overall. The 9th holds the 7th spot. Maybe a backstep would be faster, right? And the spear, we
reaches the 6th place. The Fists finish in 5th. The Battle Axe claims the 4th place. Trowel takes the 3rd overall. The Chainsaw lands in the 2nd spot. And the Butterfly stands at. This is why you should never abuse the lowest time to kill melee in Roblox Rivals, because I tested and ranked every single melee item, including the new spear. After this video, you know which melee is the swamp.
No, Dubai Air is owned by a horrible company. Not that on the southern coast of Nigeria. My home into a hellish, fiery swamp. I can no longer wear that name on my chest. Never again. Give me a turn, bro. Good. Okay, that's good. Hey, listen, I don't expect you all to do this, but I hope you understand why Nigerians must. Go meditate. What do you think of it? Entertainment, man. Can't wear the same kit.
It appears to be some sort of protest against which stops at Dubai Air.
What do we do?
What, Dubai Air not paying yet?
No, Dubai Air is owned by a horrible company. Not that on the southern coast of Nigeria. My home into a hellish, fiery swamp. I can no longer wear that name on my chest. Never again. Give me a turn, bro. Good. Okay, that's good. Hey, listen, I don't expect you all to do this.
These are some national anthems. Simple time. Fight tyranny. I mean tyranny. The king is the best.
Bishop, the best.
I am the best.
The emperor is best.
Fight for country. Defend the country. Fight for country. Fight for a tyranny. Yes, someone that loves them. You see, this is why you don't get to be a real country. I was right for Canada. You were challenging me to find Egypt. Yes, ma'am. You
speaking from. It's in Chinese, a language I don't speak. So can I still crack it? Let's start with the basics. There's no stuff.
Oh, really? Great, Bob. Well, I heard that you bring a frustrating thing. And I don't think that's something. What?
But is this ghost possible kill in Roblox Rivals? Because recently we found out that the world record for the fastest kill was 1 second and 80 milliseconds, but what is the actual slowest kill? Some people might say just get someone in the last second of the round, but that's not how it works for me. Starting out slow with the most obvious answer, using a low damage secondary at long range, but even the worst secondary clinches the job relatively quick. The only secondary you're not allowed to use is the energy pistols, since they don't have any damage drop-off, which means even on maximum range, they will shred through the enemy's HP. Now, technically, you could instantly push someone off the map on Onyx with a flamethrower, which would take a bunch of seconds, but that's the fun. Possible in Rivals, and the world record for slowest kill in Rivals is an advanced shot, and only to 1 HP body hits, which takes an insane amount of 90 seconds. But is this slowest possible? Say trade like the ball around 1 minute, 3 seconds.
Sure, you're being forced to learn cursive and how to play the role. That crab is a pain. I just can't prove it. What? So in a previous video, I told you guys that I went to a show that sold some of the world's rarest things. Well, in that video, I showed you this, a piece of slate with a crab imprint on it. Everybody in the comments said that it looked like this crab was just painted on this rock. And don't get me wrong, I don't really know. So I bought this microscope to hopefully figure out today if this is a real crab fossil or just something that someone drew on a rock. Alright, so pop the cap off the microscope, power is on. Okay, so the light is turned on down here. You can see it's already working. Alright, now I'm gonna go over the crab. Okay, so you can sort of see something there. Let's move it around. What is that? Alright, so that's the black bit. Let's zoom in more on that. Whoa. I would have to say that's the crab's exoskeleton that's stuck onto this rock. That is great. That crab is a pain. I just can't prove it. What? So in a previous video, I told you guys that I went to a show that sold some of the world's rarest things. Well, in that video, I showed you this, a piece of slate with a crab imprint on it. Everybody in the comments said that it looked like this crab was just painted on this rock. And don't get me wrong, I don't really know. So I bought this microscope to hopefully figure out today if this is a real crab fossil or just something that someone drew on a
Top 5 zesty first. And this is something like one of these games, not behind the zesty first. Number 5, you have camera. I don't know what it's about every single camera I know, but just deep down, you just tell there's a little bit zesty. Like you don't just get dressed, you just throw straight. And before we have Justin, I don't know what it's about Justin, but all of them give me a little bit of zest. You can tell they see the other way. And here we have people. Dude, I never had a single week in my life that does people a little bit zest. They're always saying the most sub thing. Number 2 is base. This is an underrated one, but genuinely every Mason I know is genuinely zest. And they're always acting so innocent about it. Like they didn't just put their ChatGPT essay into a free and something I can do crazy to make it back all the other figures. So they have more time to go out to the game or to their best stuff. And number 1, the bestest game of all time is Aiden. Genuinely every Aiden I know has a skin here. And I don't even need to say anything else. You guys are the best. The top 5 zestiest one. And this is something like one of these games, huh?
How'd you know about the sale?
One of the hardest maps to master in Open Triangles because you probably thought Onyx was impossible to master, but compared to the other maps on this list, it's actually a breeze. Starting out with Crossroads, guys, hear me out. The map is literally massive and has almost infinite possibilities. You can camp in a compound using a power force, tight and long range from the sniper, and even pull out some crazy jumps. But it's not as hard as construction, since that map has the great jump, which is easy for skilled players. But most people hate it because it's actually pretty difficult. Not the second hardest map is blocks, because of the endless variations. You can ticket jump, ladder jump, fly with the RPG or satchel. You can literally do the most crazy stuff on this map. But the last map is so hard to master that a lot of people just keep playing it. And the more people play it, the harder it gets to master. So, which map is one of the hardest maps to master in Open Triangles? Because you probably thought it's impossible to master, but compared to other maps on this list, it's actually a breeze. Starting out with Crossroads, guys, hear me out. The map is literally massive and has almost infinite possibilities. You can camp in a compound using the power force, tight and long range with the sniper, and even pull out some crazy jumps. But it's not as hard as construction, since that map has the great jump, which is easy for skilled players. Most people hate it because it's
Wow, is your car beautiful? Thank you for telling me. You know, I kind of fake one.
What do you mean you're
Well, you see how you have this cool design right here? It's like one of the keys. It's just out of screen there.
like instead of the hexagon and then the logo being there, it was like a screen or a shirt like a screen.
Yeah, exactly.
That's so dumb. Like all these new cars nowadays have so many screens. Like I wouldn't even want that on the extra thing.
Yeah, and I also noticed that your car has two holes in the back. It only has one.
Like I said, one small scroll, there's only one big one.
Yes, exactly.
Like that's like who is better than one?
Yeah, it was too cheap to get the second one. And something else I found weird is, you know how when you're doing there's a code right there? And it says something weird, like,
Mario?
yeah,
I don't get it.
wait, wow, is your car beautiful?
Yeah,
Thank you for telling me. You know, I kind of fake one.
what do you mean you're interested in this?
Right, right here.
Why does it have a crown Minecraft? That is very artwork. I'm surprised that's a Google result. I actually just recently removed the crown from my skin. I put it on after Technoblade, who is another friend of mine in a Minecraft computer that passed away. He had a crown on his skin. I wanted to put it on my skin to honor him. And then I just recently published a tribute related to him and the thought that it was worthy to retire the crown. He's been here and give it back to him. He did behave, so.
There will never be another YouTuber like Technoblade ever again. When I first had originally heard the news about everything, it was immediately after leaving the dentist after undergoing a root canal procedure, which took hours and was just extremely painful. So I was complaining about my pain, and right as I was walking out of the dentist, I got a phone call from Free. He shared with me that Technoblade had passed. It had felt like all the pain from the root canal procedure had just vanished.
Why does Drain?
If you've ever felt useless in life, listen to this idiot story because it will make you feel 10 times better about yourself. So in the 1950s, there was an artist named Margaret who painted creepy-looking kids with giant sad eyes. But somehow her paintings became insanely popular. Celebrities loved them, people loved them. So she should have been rich and famous. There was just one problem. Her husband Walter was telling everyone that he painted them, and for years he forced Margaret to stay home painting for up to 16 hours a day while he took all the credit. And he threatened to unalive her if she told the truth. But a few years later, Margaret's like, you know what, screw it. And she told everyone that she painted them. Well, Walter just said, no, I'm the real artist. So this case went to court, and the judge came up with the most savage test possible. He told both of them to paint right there in front of everyone. So Margaret finished her painting in 53 minutes. Meanwhile, this dumbass Walter said that he couldn't because his shoulder. So if you've ever felt useless,
Okay, now that's it until it moves like that.
Come on, now, move out. Oh, yeah. Oh, wow. Oh, wow.
There's no reason to feel down. I'm saying, young man, pick yourself off the ground. I'm saying, young man, cause you're in a new town. There's no need to be unhappy, young man. There's no place you can go. I'm saying, young man, when you short on your dough, you can't stay down. And I'm sure you will find many ways to have a good time. Xbox support. So my account got hacked. Account hacked? Better luck next time. We can't help it. PlayStation support. So my account got hacked. Account hacked? Better luck next time. We can't help with that. Nintendo support. And so my account got hacked. Account hacked? Better luck next time. We can't help with that. Steam support. How can I help? So my account got hacked. Oh, account hacked, huh? Excuse me. The username is Coolboy2002. That's a really nice username. Now, question for you, Coolboy 2002. What time did this happen today? At approximately 2:27 p.m. I'll be right back. Simmons, I got a lead on a hacker. P-shirt reported to while doing in Sydney. We got a Steam account hack. Coolboy 2002 code red. Send in the AC 130 above. Turn his house to rubble and make him pay for it. Let him see what he destroyed and then make him stay with it. And if he's even alive at that point, bear him no mercy. Hey, we're calling back to 2002. I want to let you know that we've taken care of the issue and your account should be back to normal. Thank you so much. Now, what do I do to make sure this doesn't happen again? This won't be happening. I did! Xbox support. So my account got hacked. Account hacked? Better luck next time. We can't help you. PlayStation support. So my account got hacked. Account hacked? Better luck next time. We can't help with that. Nintendo support. Hey, so my account got hacked. Account hacked? Better luck next time. We can't help with that. Steam support. How can I help? So my account got hacked. Oh, account hacked, huh? Excuse me. The username is Coolboy2002. So that's a really nice username. Now, question for you, Coolboy 2002. I completed one of my hardest Roblox challenges. And all I have to do was click a button. See, I stumbled upon this game called Beat Hobbies for Noobs. This game that consists of 33 Bible challenges like there's a new community course. First is a one-stuck runner. What do we have to do this? But after logging in, writing the game for 3 hours, what a correct! And beating 32 out of the 33 stages, all I had to do was beat one more stage. Little issue. I couldn't find the final stage. See, the way the game works is you cannot select a level. You are just randomly assigned an object, and no matter how many times I click this stupid skip button, I just could not find this final level. I don't even care if I get it, I just need to see that it exists. And because Chad found this whole big body, they decided to make my life worse. Lie and say that there was a hidden noob in the forest. If it's not in this tree, everybody might be shot who just said into the other tree is bad. Good luck, bro. I'll see you in 8 hours. And so I went back to clicking the button, spending an entire hour with still no luck. And so I'm going to be honest, I decided to quit. Nah, okay, I'm officially giving up. We know the hobby exists. I did get 30 minutes, but the only way I can do the very last one is by sitting here and waiting for 1 in 2 days, which is just not going to happen. But just as I was in the middle of outroing the stream,
dying, plate is torched, would be one of the rarest things, since it's literally the worst weapon in the game. But what if I told you I found way more rare thefts? Starting on stove, we got the smoke grenade. Yes, smokes can technically kill you. It does 1 damage when directed, and a maximum of 2 damage towards the head. Statistically, you might see this happen once per 1,000 hours played, but it's not as rare as dying to the warp stone. See, most players use this expensive item for loot, not for kills. So if a warp stone takes you out, congratulations, you have the worst fucking rivals. But out of those deaths, I think compared to the rarest death in all of rivals, it's an event that might never happen. Let me explain. The glass shaft does only 1 HP onto the body, which means people might have backstab with it, but no one ever killed someone with a 1 HP body hit. So tell me, the rarest, it's almost happening. It's so close. Let's go! Let me get this straight. So when the blue covers the sun, it's cool. What I do is depressing. You think of depressing? So close. So out of play. I like things better when my car hits down. Somebody stole my car radio and now it is sitting inside. The stereo, it means no use, so listen. It's almost happening. It's so close. Let's go. This should be illegal. Y'all want me to reach this tower in -5 steps. I'm not sure how I'm going to do this, but I heard they'll go again, and I won't be getting it. 3, 2, 1. This is Portland, the largest city in Oregon, and this is one of the largest cities in Maine, also Portland. Same name, but on opposite sides of the U.S. So who thought this was a good idea? Well, it was decided literally by a coin flip. 1783, the U.S. just gained independence after a war with Britain, and like in most wars, cities burned to the ground. That's exactly what happens to a town called Felton. They decided to rebuild part of it, and in the end, give it a new name. All right, let's see what we have. We have port, we have land. I know, land port. And eventually, they can't come up with a name, so they just name it after the English Isle of Portland. That's how Portland appears. Over the next century, it moves further west, all the way to the Pacific Ocean. And here, on the banks of the Columbia River, a new city appears. And it needs a name. We have port, and we have land. I know, Boston. The thing is, the city has 2 founders. Asa Lovejoy wants Boston because he's from there. And Francis Pettigrew wants Portland. Yeah, because he's from there. They can't agree, so they just decide to flip a coin. Ha! Portland. Loser. And just like that, the coin decides the name of one of the major cities on the West Coast. Funny enough, it could have easily been 2 Bostons. This is Portland, the largest city in Oregon. Hey, PlayStation might be in a little bit of trouble. Now, if you are a console gamer, you know the war between Xbox and PlayStation goes a long ways back. Now, honestly, PlayStation has really dominated this war for the last 10 years, it feels like. But suddenly, things are changing. The Xbox just hired a new CEO, and she's been making awesome changes, whether it's lowering the price of Game Pass, taking Call of Duty off of Game Pass, or even just changing the logo to look more OG. Xbox has momentum. Now, here's where PlayStation might be getting in a little bit of trouble. Just yesterday, there was an update that says any PlayStation game purchased digitally after March's system update will reportedly now require an internet connection once every 30 days to validate that license. What does that mean? If the console stays offline longer than that, the game will not launch until you reconnect to the internet. Making the console online only, the thing that got Xbox in trouble all those years ago. What do you think about this change in Xbox? Probably Hikaru. I think Hikaru won that. Yeah, it was a sick game too. Like other games. So that game, I found it. Yeah, they can't defend it. Totally missed it. It had to put this square. I played 19 My idea is to play night here and smother this kid to death in the floor. Even here. And I was like, wait a minute. I know one of those coolest things that also, do you remember the special one French word? Yes. So he was two squares, he stands side by side with me. He was here. Oh my God. I went here. So he said, my bishop, and guess what? He saw my idea. He went here. But the conclusion of this game is so sick. So I go on to YouTube anyway. When he takes, I play this anyway. He can't take the ball. So he loses his clear. The game ends with he played the sacrifice over that. He takes, I hit this bishop again. Oh my God. 95. So now he's not hitting my queen, so I hit it. He went here. I was super proud. I went here. You can only take my queen with this growth. If he does that, so takes it. Check. Don't take it like cross screenshot and you'll normal FOB. Save it back. Okay, let me prove that. Here's the screenshot that I took in my normal FOB in 19. Here's the screenshot the exact same thing but in a different FOB. Second one is way better, right? You think my FOB like cross in 17. You look at the FOB, let's the FOB job. It's not quality for Minecraft FOB. And that default centimeter says your roll coverlet with a 17 millimeter footprint. Now that might sound a little confusing. All you need to know is 17 millimeters is typically seen as an ultra wide angle lens. All common FOB is 19. Similar football is 0.5 foot for your phone. But what FOB should you use your printer? Well, it depends what your lens looks like. The 35 millimeter lens often known as a cinematic sweet spot, which is great for capturing your main subject, but also the area around it. So to replicate that lens, use an FOB of 37. If you want your screen something a little bit natural, 50 millimeters. Happy Thanksgiving. Do you know that One Piece is ending? Thanks, man. Happy Thanksgiving. What? One Piece is ending? Since when? Well, the most recent chapter of the manga, there's a flashback showing Shanks wearing an eye patch. Okay, what does that mean? Well, back in 2007, the author of One Piece, Atp Live said that the pirate with an eye patch will appear in the final phase of One Piece. He continues to say that he's never drawn any pirates in One Piece with eye patches for this reason. Oh my gosh. So this is it. The final phase of One Piece. This all but confirmed what Oda said. After 28 years, the manga is finally coming to an end. Yes, we're finally at the end. Well, I hope everyone makes an effort to catch up. So we'll write another full thing. Now back to the day, almost made these classic things. It was really cool. But he didn't say it. It was by the even I thought what it was past. Like, I don't know what we do. What changes that and found the difference. Now we have these movies. Dynamic thing. You don't have to use the camera. You don't have to indicate where you're actually done. And they don't do that. That is going to be moving look at the smelly. On the other hand, they look really hard. The original television was really good. But the dynamic thing, why did we make the tone look like that? But now you probably think people were too much just the original one. And that could work. It could have take the original off to make the mobile. Let's go. Let's get to the advance. interesting story writing mechanics. Interesting. Okay. When you pull up to the Starbucks with gang and the femboy cashier says the usual, right? With extra space. Jesus Christ. I mean, honestly, if I went to a Starbucks and there was a absolute hottie, like the hottest woman I've ever seen, maybe I would slip her an extra 20 if she quietly spits into my Starbucks coffee, maybe in GTA. I mean, so I can understand if this guy's in the femboys, maybe he's just asked the femboy to spit into the drink. I mean, is there anything wrong with that? But like a hygiene point of view, maybe, but like it's not. No, he's fine as long as it's Western, right? We are raising funds for cancer patients. Would you like to donate? No. Just think about the kids. Whoa. What? Why would you make this? This is not funny. This is messed up. This is disturbing. So thinking about the kids gets you like this. That is absurd. Who the frick just said W? What? Who just said W? You're weird. That is insane. That is actually insane. What are they typing? Whoa. Did anybody just see what passive of letters he was typing? Jesus. I could see this coming from a mile away, but yet I was still like, why did you do this? Relax. In Roblox as well. Jesus Christ. Oh my God. So this is how you bypass. You type it, not using your keyboard, but using a keyboard in the game. Okay. Jesus, why are kids so racist these days? It's actually insane. Okay, at least it doesn't. What they type? Oh my God. It's time to look and make more money. Oh my God. Okay, we're blurring and censoring everything about this. Okay. If you're watching the YouTube video, basically, if there is a stupid Daffy Duck dressed up as the Austrian painter and he is doing a bit of a silly
bin ich aber mal auf ihn gespannt, wie der so ist. Oh, ich glaube, das ist er.
Is this German? Germany?
Oh.
I thought she was going to open the door and it was going to be some massively overweight physical boy. Okay, instead it's just a black person. What's wrong with her, the daughter dating a black person? And they filmed it on camera as well. She's just self-reporting herself. And they filmed like they posted this as well. Our male teachers look at you when you interrupt their flirting with wall. But I'm not gonna lie, I think I've said this is like for some reason this happens at every single school. I mean every single school I've been at, I've noticed the teachers may or may not have been doing something like this. That is concerning though. That is very concerning though. Introduce myself by saying, oh, you must be Becky. I know her name, and it's not Becky. Oh my God, okay. Okay, so you're just going to try and, like, plant something into the girlfriend's mind into thinking that, like, the boyfriend's cheating on her, right? Brilliant. Good job. I mean, is it funny? I mean, it's kind of, as a prank, it's kind of funny, as long as you reveal it's a prank. Somebody just said that they oh, look on. Me giving my dad alcohol after my mom took my PlayStation away from me. Okay, that's not funny. That is a domestic violence.
reality joke. So basically, what you want to happen is that your dad's going to get violently drunk after drinking this bottle of alcohol and beat the frick out of your mom. And then while your mom is completely beaten, you can just slowly scream and take the PlayStation back. Okay, why did my ding dong just fell on my thing? This is not the solution. This is not the solution. Okay, we do not support domestic violence. This is not funny. When versus make yourself a harm, so I start beating his kids and drinking all the alcohol. Oh, okay. So at home, the guy usually beats his kids and drinks all the alcohol. So when he visits somebody else's house, he can just do his own home habits and just beat up the random kids and just drink alcohol. I mean, he did say make yourself a harm. I mean, he did say go ahead. When Bird beating the frick out of his girl and she looks at me for help, and I remember when he stroked it for me when my arm was broken. Really? So you're not gonna help this innocent girl get beaten up by your friend purely because your friend stroked your dingling when your arm was broken? Were you not able to just stroke your own dingling with the other hand? So purely because of that, you're gonna repay the favor to your bro and not help his girlfriend when she's getting beaten the frick out of. Jesus, I've seen so many variants of this. Is this really relatable?
I'm in the playground, bro. That is very good.
Why was he hanging around the playground? That's why he didn't want to enter up that relationship. He's into another game. Girls, he's a child.
Oh my god, okay, yeah. Somebody actually check his phone. Not even Phil. Somebody check up.
Racism game. If you are racist to the following races, you would have to. White people, black people, Indians.
Oh my god. Whoa. Wait, so if you're racist to any of those people, you're dead, and everyone's racist to Indian people? That's insane. Okay, I'm not even going to ask you guys who would be dead in chat. That is insane. Me personally, I've never been racist to any race in my entire life. First wave of feminism?
Let me vote. I can say this all day. Let me vote.
Let me vote. I need to have a vote. What the hell is this? What game is this? This is actually funny. I want to actually go into this game. And so how do you even trigger this? Like, how do you trigger this? You just shoot some random person and then the woman will grab her neck, violently doing his skull with your fist or something. Chat just said 11. So projecting yourself, you don't milk. I've never in my entire life been milked or milked myself. Okay, I do not do that. I've never gooned in my entire life.
You don't have to be the bad guy.
Okay, I mean, why are you even friends with somebody trying to enter a elementary school with no clothes on? I think that's illegal. And also, what type of friends are you hanging out with? Honestly, stop hanging out with these friends. I don't get it. Well, let's go watch the George Floyd movie, and this guy's just laughing the entire time. What is there to laugh at? Like, genuinely, what is there to laugh at? What are you laughing at? Somebody died. George Floyd died. Special ed kids 5 seconds after receiving the high school diploma for doing first grade math for 4 years. Wait, what did the guy say? What did the Yogami light say? One exactly as planned. What is the caption again? Special ed kids 5 seconds after receiving their high school diploma for doing first grade math for 4 years. I
mean, maybe they entered school early. Like maybe they were they started doing first grade math in kindergarten, and then when they were first grade, they finally got the diploma for the first grade math. Okay, it's just calm down. Like it's relax. It's okay. It's okay. Just relax. Relax. This is not funny. This is rude. This is a rude meme. Here, Bird's hand brushes my leg. Whoa. Getting rock hard dingling after being touched by your bird. I mean, maybe you're introduced, there's nothing wrong with that. Or maybe you just never felt the touch of a woman before. Honestly, there's nothing wrong with that either. Very interesting. The first time I showed you this, the Japanese focus, a radio cooking. Cooking here. Trying to get birds to join the Japan trip for the Japanese football club. So you just want to go to the land in Japan. That's why you want to go to Japan. You don't want to experience the culture of the culture, the food, the arcade games. You just want to do the pretty. Okay, interesting. I've read a lot of things about there's places in Japan, and I've never, not even once been visiting with those establishments. When birds try to block my stomach, squeeze my butt up. Oh my god. Okay, it's trying to pull out something, and so you just go, and you tense. Good idea. Ow! Oh my god. What should people do? We can't let a baby pass us. Right, the world's first $1 million.
Oh.
So Joanne had a fish, or give him a bucket. Since I'm here, how was free living? How was free? Tell me how to make sense. Hey, listen, guys, listen. We all know who the true leader is. You're looking at it right now. It's so goofy how we might, bro. Can anyone share some word with me? I put my whole Lucy into it. Lucy? What is Lucy? What the lag is it looks old like, bro? Have you guys seen these sheep? Oh, no, what do they look like? Please come outside and look at the sheep, bro. Our money is just a sweat. Let me hear the sheep. Okay. Where are you guys? I'm coming. Move in. Where? Over here. Jumping. Over here. To the right. Yeah. Oh my god, bro, that jump. I just did a 5-block jump. Square down. Bro, a 5-foot around. Who do you about that shit? You just said that. Oh, don't kill it. Right. I got one, guys. Hey, oh, big bet. Yeah, why the mountain with it? We need it. And then we would have got more out of it. Or you guys could just die. You guys just probably die. It was big. Why is that? Hey, what is this? That is not a village, bro. That's a circus. No, it's a cow. Right there. I think that was a cow. Guys, I don't know what this animal is, but I think it's ostrich. It's an ostrich. Walking around ostrich. But you're right. It is, right? It is. It's okay for you. Wait, I'm going to make a coffee table, and then I'll make an axe. Okay? I'm going to try and kill the ostrich, guys. I'm going to kill it. Put it up to those 3 feathers. Because guys, look. So like, you want to take break this time, and then doing your property. You currently get good up there. But you don't have to play that all the same. Yeah, look. Boy, why can't you not just like right click and open it up? Wouldn't that be better? You click on this set it up. You click on go back. How do you get back there? On it. Oh my bro, look at the spider, Oh, yo, chill. What is that? Nah. Oh, careful, creepers are crazy fast. Yeah, that's food quality. Yeah. Hey, food, bro. How did the water even? It's like a real explosion, bro. Guys, I feel like I swear I feel like I don't like you though, because I'm alive as well. Oh, yeah, you're like, yeah, but I also told them I know the language. So what? The way I look at it, that's so alive. I swear to you, I saw a lion. Under the pool. Look. A what? A pool. Oh, wait. Yeah, it's so big. I want to see what the key is. About to ride. Oh, God. They're flying at rocks. No, they're flying west. Those bugs are going to different directions. The sound of the wind, right? I don't know. Yeah, I don't think they pulled that far. There's no. Why is the sky changing? Go to turn, after, go to store, like that. Little thingies. There's a little stuff, lava. So sick. Look. Oh my God. So look at lighting. Look at the house. Yeah, I heard. Yeah, there's huge rooms to get up there. Oh, look at this. Look at this. What is happening? You don't find the water. There's people in the water. Tiger. There's water over here. Water on the other side. All of that. Good. All right. So, when you're like a focus for that mission, stuff that you want. That's how you do it when you go watch it. Well, you're the only rest you take up. Watch that. Oh, okay. They're for free. Wait, with you? Oh, that's pretty good. With me? Huh? Me, real? I got you. It's not me. Living, that's me. Was it all right? Whoa! Whoa! No! What happened? Why did all this pregnant go away? What? You actually say that. That is the abomination came out. A third, tiger. Sorry, put the lion, put the large red tiger, and I yeah, let it stop, otherwise I'm going to destroy your look. I'm leaving the good boy, bro. I'm leaving the good boy, bro. You called me, and I'm letting you. I said, you already left 3 months ago. No. I'm 3 months ago. That was before we went to the house. Yeah, exactly. This is me hitting what you want against five of the most famous Roblox players of all time. And if I can't beat them, I own at least 10,000 Robux. But before that, I want to take on 4 of them at a time, 3 of them at a time, 2 of them at a time, and also just try to get into the play of title. And it's hard to break. It's not easy. Never have, never will. And I'm hoping I beat you because every round I lose, I never use Robux. Meaning, I just lose a lot of money. And I can just hit down Robux. I check all 5 rounds. Every round I can add a harder and harder opponent. I'm definitely taking the whole thing. You're half my level, dude. Okay, what happened to us? Let's start. First YouTuber. What do you want right now? Arena. No, I don't think so. You want to play? I can play. There we go. I'll take that. Okay. You go to circle the folder, site, and I'm I should have copied you. I just put like a different one. All right, there we go. All this on? Oh no, sniper. You're really good with this sniper. Are you serious? I don't body shot. Another body shot? Ooh. Why are you so good with that thing? What? You watch out, you watch out, you watch out. I could not get your head tonight. What is going on? See. And dead! I'm not going to do good for sniper today. Let's swap it up. What's your own? I'm not better than you with your own. Assault rifle. It's assault rifle, revolver, sight on it. And it's nice. Hey, stop! Hey, bro, I'm trying not to lose Robux, bro. I'm trying to save as much as I can. I just lose up to 100,000 Robux today. Now, that was a free round. That is not fair. All right, I see how the play is. I get it. Now on, I understand what it was. Okay, this is my load up a little bit, and maybe I should have changed it by 50. Watch out. You said that. Where are you? 50? Watch out. Direction, watch out. You have to buy some first. And no, you're 20. What's that? Maybe you should go back to the assault rifle, okay? No, you keep the sniper. I know I can watch out for this thing. I just missed my first shot, which was the flash shot was fun. You can hit me. You can hit me. Yes. Hey, I'm getting 5 of that shit. I can think of when I have 5 YouTubers that are destroying me. Hold on. I think it's time I logged in. That's 50? Wait, look.